person in the field of intellectual and developmental disability, and he is he is one of the pioneer in our country for introducing the services and HRD program for the intellectual and developmental disabilities. So we will be having such a great personality with us for deliberating his knowledge, sharing his knowledge in this platform. So I welcome sir, and I also welcome Dr. J. Vijayalakshmi, HOD of former HOD of medical science at our institute, and now she is supporting us for various projects, and she is also having vast experience and knowledge working for person with HA and additional disabilities, hearing impairment and additional disabilities, and she had ample of experience in the field of deaf blindness. So deaf blindness, she underwent some experience and training with Perkins Institute, and with that experience, she came and practiced, and she was instrumental in bringing the course for deaf blindness in our institute. She has ample of experience, and she is going to deliberate. She is going to share her experience with you, and we are also having our own department people, our own institute people, the resource person for deliberating among the group. So I invite the faculties involved in this program for organizing and conducting this program and deliberating the lectures, such as Ms. Leelavati from the Department of Special Education, Ms. I.G. Amshia from the Department of Special Education, Dr. Revati from the Department of Special Education, Mrs. Sri Gauri from the Department of Clinical Psychology, and the other staff members who is going to support for conducting this program. So I also welcome the parents and the children with the special needs to join this group. I also welcome the scholars and the trainees to join and then get the benefit. And I also welcome other NGOs and government organizations to join this group and then getting the benefit at large, which is deliberated by various speakers. So with this, I request all the participants to join together. I welcome all the participants to join together and then make this program a successful one. Thank you. Thank you very much. Thank you, Ananda.
Thank you, sir, for your valuable words. So I think the participants will definitely take note of the things you have mentioned. So moving to the next, we have most admired, respected, and celebrated guest, Professor Jayachandran Ser, Director Vijay Human Services, Chennai. So a man who is behind for many initiatives, various for various activities for the 4 decades of services to children with differently abled. Everyone knows you very well, sir, because that of creating an individualized educational plan for intellectual disability children and many more. Now I invite to give a keynote address in this webinar. So we are all awaiting to listen from you, sir.
Thank you very much, madam. Kamra sir, thank you very much for the lovely introduction, and greetings to all of you. NIPMET faculty. I'm very active, going to be active in NIPMET after a few years. Thank you very much for the invitation. And when we talk about this program, as a senior person, I have to recollect the past, the history. And when I entered the field in 1968, we never had even special educators. We were searching for special educators. And there was only one center which was training special education program. And when I went there to see what kind of program they offer, special education means they said kindergarten method, nursery method, Montessori method, and regular method like that. They were putting everything together and trying to offer a program. Then we thought we should have a kind of good program. I was lucky to have one of the most eminent person, the person who wrote first textbook on special education, Dr. William Cruikshank. He was our advisor and he was interacting with us very much. And I said, we have to develop a kind of staff training program. And he said, in India, the requirement is so huge, so we cannot have a long staff training program. I said, 1 year program we will offer. And I cracked out the kind of syllabus for our people. And that syllabus was accepted by RCI. Later, it was developed, and that's the syllabus we are using. And I'm very happy to be with NIPMET because myself and Dr. Amarnath, we were really working very hard to establish the institute. And lion's share is Dr. Amarnath. He did a lot of work. I was sitting in the room and helping him. Then I must come to this program. And in 1968, that's a kind of really red letter day in the field of disability, I must say. We had good consultants from internationally, especially from US, William Cruikshank from Michigan State University, and Dr. Gelman from Jewish Vocational Center, Chicago. All those people, they wanted to find out how our 1 year program is going to be. And they were just there to listen to a few lectures, and they were very happy. And before this, all these people came into our work, and that is very important. And in 1968, the government of India and the US State Department, they jointly conducted a research. In that research project, I was appointed as a psychologist. That project is called Feasibility of Training Parents of Mothers only. Mothers of mentally retarded in those days. Now we call them intellectual disability. To be very brief, it's a kind of 3.5 years project, but very briefly, I will say, we had about 120 children, age group between 4 to 6, IQ around 50 and below. And group A, we had 20 parents and the children. Similarly, group B, 20 parents. A, parents training for 6 months. Group B, parents training for 12 months. Group C, children were trained without parents. Then group D is from the various institutions where the children were brought up. And the fifth group is the control group where there was no training. The children practically were tied up in the rope in the houses. These groups were taken, and we developed the program for the parents to train at home as well as at the center we were training. And at that time, I was planning, I developed, I wanted to be accountable to these people. So I developed a 24 hours timetable for every child. 24 means in the school what they will do, who will do, in the house what they will do, who will do. And if the father is very busy, he will spend about 5 or 10 minutes with the child every day. Like that, we have worked out a timetable and we made the program. And the result of the program is, surprisingly, the children were not exposed to any kind of stimulation. Group A, that is parents with 6 months training, also achieved so much like the group B, parents with 18 months training. And more or less the same, the two groups achieved the adaptive behaviors equally in 6 months period. Group C, without the parents, I'm putting it short, the long project. It took 18 months. What the children achieved in 6 months with parents training, without parents training, the children roughly took about 3 times or 18 months to achieve the skills. And surprisingly, when we were following it up, the children who had parents training for 12 months or 1 year, their forgetting level or to maintaining the skill is more than the children, the parents who had 6 months training. And surprisingly, the children who were brought up in institutions, they have picked up a lot of skills in self-help and other skills, but they have not developed the academic skills or reading, writing, number like that. In any skills they have not developed. But this was an eye-opener for us, and we were following these children for about 3 years. And in that project only, I was made to develop the first assessment scale for persons with intellectual disability, first time in India. That scale, later we developed and developed and developed. Now what we use, the MDPS programming system, was developed from 1968 to I think 2006 final revision we made. The other revision we are making. Then, based on this, we found what are the needs for the teachers to train these children. In this setup, we have developed a better curriculum for the teachers training, and we started training the teachers. And we must also look into the various factors. What are the problems our children face in this period? Preschoolers, they have about 82% medical problem. So initially, we have to co-opt a medical person to provide services. And this program is reduced during the adolescent period from 82 to 27%. And when we were developing this program, then we developed how to train these teachers, in what skill to train these teachers. We developed a good systematic program, and if someone could get this full picture or the flow chart we call technically into their mind, they are good special educators. The whole special education is summarized in this. And so initially, when the child comes, you have to do the assessment, then you have to set the goals and objectives, what you are going to achieve it. Then you have to do the evaluation once in 3 months. This is how I evolved the program initially, and it is still being followed all over the world. It is accepted, and the whole program in special education is only 3 steps. Initially, you have to give an assessment. Then, based on the assessment, you have to select the goals, that is, major area to achieve, and the small objectives, what you are going to achieve in 3 months' time. And that should be evaluated. This is very key. Based on the evaluation, we know whether we have achieved or not. If we have achieved, very good. If we have not achieved, why we have not achieved. This is what we are doing this program. And later, in 77 or 79, when NIMH started, they have developed 2 more behavior assessment checklists, not scale. They have checklists, and it's being used all over the place for programming. And it has been, it's a kind of requirement by RCA in their curriculum in teachers training, and they make the training. Then we go to the next step is when we see the difference between a regular developing child, say what they develop motor activities in 8 months, a Down syndrome will take 12 months. For example, standing, regular child will do sitting 8 months, standing 14 months, walking for 15 months, whereas the Down syndrome will take 12, 23, and 26 months respectively. So, what are the problems we have when we take the children into the program in the preschool stage? 82% of the program are medical oriented. Then later it comes down to 38% and 27% respectively. Then in those days, we were trying to say that the people were mildly retarded, moderately retarded, severely retarded, and profoundly retarded. Later, it has been changed to a kind of based on support system. The people whom we call mildly retarded, we now call them, they need intermittent support. Intermittent support. That is, whenever there is a need, support will be provided. The next level is limited support, constant but not permanent. Then extensive support, constant, not time bound. Then pervasive support, that we provide them always some kind of support. And to make these children with this kind of range of needs, I don't call that as a problem, needs, we have to give them training all over the world. It is proven that behavior modification techniques are very, very effective. In my personal capacity, after 52 years of experience, I vouch for that. That BM technique is wonderful. What BM technique? You say where the child is and where we should take him and whether we have achieved him or where we made him to achieve or not. Once we made him to achieve, what are the strategies we have used and where we have to change? These are some of the things we have to use. And in that, all the teachers, all of them, even the parent will know the task analysis. It's very clear. Take the task, break into small, meaningful steps, and execute that. And in that, you give a reward. And after that, you add one more step and give the reward. Like that, we found later, sometime in 77, 78, in a program like toilet training, eating, self-help skills, we used reverse programming. Then in India, we have a lot of program for the human resource development. Not only development, and the manpower available is very limited. So we have to use the parents, peers for training these children. These people, in behavior terminology, they are called as carry-over agents. They carry over what you teach in the center, they carry over in the houses. Then I must say one thing, the associated conditions for persons with disability fix a major problem. We have to handle that. We must set right that. Then we should, when we do that kind of work, in India, we have very little research guidance for us. Very good result we have obtained from research programs. So what we have little is a kind of special education strategies. We can use all the strategies, peer tutoring, parents training, all those things. And when we do this, we should see the word self-esteem. The self-esteem of the parents and the children should not be affected. That is, once the self-esteem is achieved for them or it is protected, the children grow better than what we expect. And I think my time is up, and I like to thank, I'm not very familiar with the kind of system to use, and I thank Madam Kalusha, her sister, Madam Anandanahi, your department person, and her lovely daughter, Dr. Gayu. We call Gayu Gayatri for helping me to be with you all. Thank you very much. Thank you, Comrade Sir. Thank you very much.
So thank you, sir. Thank you very much for your wonderful speech. Thank you very much, sir.
Thank you, Comrade Sir.
Thank you, sir, for
Thank you,
sharing
Revati
the memories. Yes, sir. Thank you, sir. Thank you, sir, for sharing your memories about the establishment of NIPMED. Well spoken about challenges and many programs that brought in to the field. And also, thank you for talking about little about the scenario around now. Thank you, sir. Thank you. It is very little one, but I know, but we are giving this much. Very much wholeheartedly, sir. So now we will begin with the session. We have invited speakers to talk about the plan and
Madam
tips for.
Revati, one
Yes,
thing.
sir. Yes, sir.
You look smart. You look smarter than what you are. Very good.
Thank you,
You
sir.
look very smart. You look very smart.
Thank you so much, sir. So Yes,
Okay.
we have invited speakers to talk about the plan and tips for managing children with multiple disabilities and autism spectrum disorder at home. So, to introduce the first speaker, I'm handing over this to Miss S.R. Geeta, lecturer, Department of Special Education, NIPMED.
Good morning, everyone. I am happy to invite Srimati I.G. Anushya for the session. I am here to read about her introduction. She is graduated from NIMH, now it is NIET IB, and she has done her undergraduate from SNDT University, Mumbai. He has 20 years of experience in the field of rehabilitation in various areas of cerebral palsy, intellectual disability, autism, and multiple disabilities. She has authored chapters and units to both university study material and RCA manuals. And she has translated chapters for study materials of PNOE. And she has been the question paper setter for RCA recognized courses and the paper evaluator for TNT University. And she is a member in the inspection team of RCI and resource persons to various programs of RCA and other institutes. And she received the Best Rehabilitation Officer Award and Award of Appreciation for Cultural Events at President's Office. And she's an active member in various committees of state governments, projects like establishment of resource centers, development of curriculum for early intervention, assessment tools for CWSM in mainstream schools. So I invite Anshia ma'am to add to the session. Over to Anshia ma'am.
Thank you, Geeta, for good words. Good morning, all. I thank my HOD, the organizer, Dr. Revati, Director, Mr. Nachiketa Rao, and all the team of special education for getting me this opportunity to address at this platform. The topic is really worth listening to. It's a good choice of topic chosen by the organizer. And now me presenting next to a legend, an eminent expert is getting me into nervous. He had spoken so much about the special education and how much he has given input in developing the scale and then developing 24 hours of schedules for children with special needs. It was then in 1968. His experience is equivalent to my age. So I'm happy, sir, to present after you, which really formed a platform for me to begin with. It's a good foundation that I got to start with. Thank you so much, sir. Now I'll share my screen. Kindly bear with me for a few minutes. Is my screen visible? Okay. To begin with, the title itself has its own meaning to understand, creating a daily schedule for students with multiple disability and autism spectrum disorder. Having this day, I think it's a good start because the National Education Policy 2020 addresses in similar concern. It has got its valid point to stress upon the homeschooling concept. So I think understanding this topic will really help the professionals working for children with special needs in this field. Yeah, to have an understanding.
One second, ma'am. Your
Yes,
screen
please.
is not shared, ma'am. Now
Is it?
we are getting it. Thank you, ma'am. Now
Yes.
it's visible, ma'am.
Yeah, thank you,
Sorry.
thank you.
Yeah,
Yeah,
please continue.
yeah. So this period, I think we should thank this COVID-19 situation, I guess. We are able to get to see many experts coming online to share their experience and then their knowledge with us through an online mode. And again, we'll move on to the actual topic. And now, having children with special needs at home, what is the scenario of a parent? We need to understand what are the challenges they face before we get into it. Basically, if we see challenges, it falls on economic status. They have challenge to occupy children in a meaningful activities, to keep the children indoor for such a long time. Yeah, having children 24/7 at home, not allowing them to move around as there is a big risk of this pandemic situation. So this also is a big challenge for parents having children for such a long time at home. And then ensure and retain learning of the children. Children learning at school, having less of input on many things, ensuring and retaining learning of children for parents is again a challenge factor. And therapeutic and medical intervention, academic learning, interaction with people is limited. They may become fearful, angry, and upset in the face of forced or unexpected changes. Difficulty participating in movement may not be like how they get under the supervision of the therapist or internist. And then the academic learning. Having seen all this, economic status, occupying children with the meaningful activities, keeping children indoor for a long time, ensuring and retaining learning of children, therapeutic and medical intervention, academic learning, I think we as a professional, maybe some of the parents were part of it, what we have to understand is we have to think about the child to know their needs. What are the basic needs a child with special needs are looking for? Okay, the unconditional love, physical and emotional security, yes, your time, your appreciation and encouragement, your understanding, support and guidance in times of need, disciplining the act, yeah, not the child. And what we all are expected to do, or what we can help the parents to do, is be the role model of whatever you expect for the child to behave as such. Okay, so we need to understand what these two types of disabilities we are going to address to. So we know what multiple disability is combination of two or more disabilities. When there is a combination of two or more disabilities, it includes 21 that has been suggested or mentioned in RPWD Act 2016. In that, what we have to understand is not all the information I have put in, but I put in information which would really catch our interest to plan our activities. One is they have problem in processing information. So processing information is a problem. It hinders their understanding of instruction and following the instruction. They have inability to organize or problem solving the responses. Their communication is affected. They may have speech characterized by substitution, omissions, etc. They may have difficulty locating sound direction. They do have certain behavioral issues which may be because of their communication deficit, or because of the sensory deficits, or it may be because of the benefits of many other things. So they have problem in carrying of ADL and self-care skills. To follow on that, they have difficulty in mobility, physically they are clumsy, they experience fine motor deficits, they are poor in learning, interaction with people is limited, they may become fearful, angry and upset in the face of forced or unexpected changes, difficulty participating in games involving motor skills, they forget skills through disuse, poor short-term and long-term memory. They have trouble generalizing skills from one situation to another. They have difficulty learning about objects and their relationships. Having known all this about children with multiple disabilities, we will also help ourselves to understand what children with autism spectrum disorder may have challenges. Here I have mentioned only few of it, which is of our concern for our planning of daily schedules. Children with autism often have poor language and communication skills. They exhibit their frustration through inappropriate behaviors. Please understand, they exhibit their frustration through inappropriate behaviors. They tend to process visual information better and faster than auditory information. Children with ASD are at comfort zone when the environment are predictable, may have difficulty in transition. Here the keywords that we have to look for is they are comfortable when the environment is predictable. They have difficulty in transitions. So if it is predictable, they are at comfort zone. They can have less anxiety. They may not exhibit any frustration because of that. Another information we have to take around is they are more comfortable or they can process visual information better than an auditory information. So having known about children with multiple disability and children with autism, we'll move on to what a visual daily schedule will speak about. What is visual daily activity schedules? Visual activity schedules can be defined as series of images, pictures, photographs, or line drawings used to depict a sequence of events. Frequently, the images are used to prepare the individual for the next activity, the next step of an activity, or a sequence of activities. Here, the sequence of activities are depicted in a visual form, which helps a child to understand what the events are in a sequential order. So the sequential order is something that helps in predicting what is going to happen next. Okay, this can be of images, pictures, photographs, or line drawings. Hope you're clear with what it is. And who can use visual daily schedules? Do you think it's meant only for children with special needs who need a daily schedule to follow? Even you and me benefit with having a daily schedule. Many of us have a habit of having to-do list, isn't it? The to-do list is nothing but the daily schedule that we prepare. And we also happen to hear from Professor Jayachandran's lecture. He said he has designed a 24-hour schedule for children with special needs. Yes, it was in need and it is in need and it will be in need. So visual schedules can benefit all people who need help with keeping track of activities or help with a sense of time. Yeah, time management is most needed of the hour as we have many roles to play in this world. So why visual daily schedule? What is it going to help us with? Yes, this is something like with a concrete schedule. Please understand, it's a concrete schedule which provides structure and a predictability. A child can, by following clear pictures and descriptions, recognize the order and importance of daily activities. I don't know how many of you have this habit. Whenever you get to buy a book or get to know about a book, what do? We see the title, we tend to turn to the last page of the book to have an outline of the book, like to get oriented about what the book is going to talk about. When you have that information being registered in your brain, you will be able to structure yourself, or your brain will get tuned to go with the flow of the author. The similar way, when you have this kind of a schedule, children getting to see all that, he or she will know the order and the importance of daily activities. And very important thing when you talk about children with specialty, especially autism spectrum disorder, this reduces stress during day-to-day tasks, which could lower their tension, aggression, anxiety, and other behavior problems. Children with autism, if they are clear with the routine, if they are clear with the schedule, if they have been provided with the daily task to perform, which is of structure in form, many of the children with autism will not be in a position to execute any behavioral issues. This will solve most of the problem. Like, this is what we speak about antecedent factor in it, which you'll be hearing in the next speaker's session. And it also helps to communicate information to individuals. Without even discussing about it, a depiction of picture, depiction of information on the schedule help an individual to organize himself in his thinking. Students struggling with receptive language, processing of language, use of visuals help them to assist with comprehension and understanding of the verbal message and printed message. Yes, like when children with autism especially, or children with high support needs, children with multiple disabilities, they have difficulty in processing information. Maybe some may be having difficulty in processing auditory information. Some may be having difficulty in processing visual information when it is provided in 2D form or maybe in a print form. So there are different aspects that we have to think about a child when we design these schedules. So if you're understanding about individual with special need and his style of learning, his pattern of learning, his rate of learning, his needs, and etc., I think that would solve many of our planning aspects. How do we design a visual schedule? This is where we tend to use our own strategies to derive at a concrete schedule. What we have to do initially is, as you all are aware of it, identify the skill or routine you want to target. So it can be as a skill or a routine. How do we derive at that? We need to do a detailed assessment on that. I think this was referred in detail or explained in detail by Professor Jayachandran. So you identify the skill. The skill can be of the need of the child. It is always learner-centered process. So the learner, the child is the center of our design. So once we understand their need, the development of the plan will be quite meaningful. Once you identify the skill, break the activity into simple steps that the user can easily understand. So breaking the activity into simple steps, if any special educator would relate to, oh, this is what is task analysis. Exactly. So the task analysis is what is to be performed once you identify the skill or the target goal of the child. So have them divided into simple steps that would be easy for a learner to adapt. It should adapt the learner's needs within that. Maybe a child's capacity should be taken into consideration when you divide the steps as simple as you want. Then determine the length of the schedule. The length of the schedule is nothing but the duration of the schedule. Do you want the duration to be for a half a day, 1 hour, or maybe full day, or how many the hours that you want to design? It all depends upon the child whom you are working for. While some individuals are able to use longer schedule that spans entire day, other users may benefit from using multiple schedules with fewer steps. There is no hard and fast rules that you have to have only one schedule and it has to comprise about all the skills in it. No, no. You can have an option of going for multiple schedules with fewer steps. That gives a sense of an achievement for the child and a motivation to proceed as well. And as a trainer, you will also have a comfort in handling the children, comfort in helping the children in developing their skills. Okay, so in designing all this, we have to understand in what symbolic level my child is. If I need to communicate the schedule, what symbolic level my child is. Is he at object stage or is he at photograph stage? Is he at picture symbolic stage or line drawing stage or text stage? This we need to understand through our assessment. When you talk about object stage, it is use of actual objects to communicate. This is the concrete materials. We know we have to go from concrete to abstract. When you talk about concrete, this itself will depict the level of functioning of the child. Some children will depend on the concrete information for them to understand or process the information. So you can have concrete object to communicate. Say for example, you want the child to do a ring set. So one sample of the ring set can be in the visual schedule. For him to understand, I am going to perform that. So it can be object, or maybe you want child to do brushing. So you can have a miniature of brush there. Maybe he can touch or he can see and then he can proceed on that. Especially children with high support need, children with multiple disabilities where two or more combinations of challenges are there and the needs varies. We may have to give them with a multi-sensory input in the visual schedule. They may have to use their visual, auditory, kinesthetic and tactile input to perceive. Maybe they touch and feel, maybe see and perceive, read and perceive. So according to the need, we will have to manage that. So photograph stage is using real photographs. Picture symbolic stage will use colored line drawings and line drawing stage will be using a black and white line drawings and text stage is use of written form of words and numbers. Okay, what do we assess? We all are part of this assessment in many areas, many times for the child. But when you talk about developing a visual activity schedule, what should I have information in hand apart from other informations which may have to be in hand? Like very important thing that you have to focus about is when I have to introduce my schedule, the child's attention is to be observed, the joint attention, especially in children with autism, the imitation of the child, imitation skills in the child, their receptive language. Receptive language is comprehending the instruction. Okay, and then expressive language is able to express his thoughts and information that he wants to share with others and his likes and dislikes and interests. So these are the areas, major areas that we may have to have content in hand for designing a schedule apart from their strengths, their performance in their other domains that we have in for designing their skill areas. The prerequisite to start a visual schedule. Yes, visual schedule can happen only if the child has got the following levels of performance. One is they have to be able to match object to object, match cards to object, and match card to card. Matching object to object, like we saw in symbolic stage, first one is about object stage. When I give an object in hand, the child should be able to match that object at the workstation, and then he has to start the work. Let's start the activity. So this matching an object to object is important for a child to develop. We need to teach the child to develop this, which in turn will help him in using the visual activity schedule. And matching cards to object, same way, which is of flashcards to a real object, and then matching card to card have a picture to picture or word printed in that to the word print. So these three are the major prerequisites we need to see, or maybe we need to help the child to learn before using a visual activity schedule. Yes, the matching sequence can have this in line: objects of colored photos, black and white photo, and a color drawing, black and white drawing, and written word. So matching sequence is matching object to object, a card to object, and card to card. So if we have this sequence can go with this order: objects, color photos, black and white photo, color drawing, black and white drawing, written word. Yes. Where can we use this visual daily schedule? It can be used in home setting, a school setting, any outings, and daily routine task as well. So it is not referring to any particular area. It can be used anything. It means visual daily schedule can be portable. It can be fixed or it can be portable. You can carry it with you wherever you want. The child to understand the sequence of tasks he has to perform and then execute it. Okay, having this, what we are talking about, how we do what we do, but what child is going to gain from it, he'll be able to know what I am doing right now. How do I know I am making a progress? How do I know when I am finished and what comes next? Yes, these 4 areas will be very predictable and structured for a child to process his thinking when provided visually. Okay, there are 3 phases in using a visual schedule. We have a pre-transition phase, a transition phase, and a timer. Pre-transition phase is where you help the child to have, like you give the card to the child and the child moves to the play zone and then he plays there and then brings back the card to you. That can be of a stage. And then there is a transition, like if he has to move from one activity to another activity, how are we going to help the child to move? Usually shift of focus, a shift of attention is a big challenge. This needs to be taught for the child, or you have to model it to the child for him to execute. So when he has this transition to be done, we can use a timer. A timer is something that will help a child to prepare himself to move on to the next stage, next activity. So to have him prepared for this, maybe you have to orient the whole set of activities to the child before he really starts, so that he will know I have got to do other tasks in my day. So this will easily help him to transit, and then you can have a timer. The timer should not be done through using a mobile. It has to have a stopwatch or a clock which can help. And this time gap should be maximum of 2 minutes or 3 minutes, not beyond that, for him to transit from one activity to the another activity. Okay, we'll see the example of that. First, then schedule. Initially, when you plan a schedule for a child, like whole set of activities introducing to him may be confusing. So what we can do to help him to get tuned with the schedule is have first and then. How to use that? Show the student the first then card. Point the 2 symbols and say first activity, then activity 2. When the first activity is done, show the student the first and then card again and say activity 1 finished while pointing to the first visual on the card. Then begin activity 2 immediately. This is when you are training the child in the initial phase of using a visual activity schedule. So here are some samples to get to see. First and then the child has to do a book walk and then can go for a play as a next activity. So this is a simple one. And when you have to increase the complexity in that, you can go for first, then next. So you add on the task to the child's schedule. Here is a vertical one where, like, sometimes what happens, all of a sudden the schedule may change. There can be a change, or you want to give a choice to the child in the schedule. So maybe what you can do is have the schedule done, and then what you can do is have the choice mentioned along with the schedule. Say there is one blue choice and there is an yellow card with a choice. So there the child has to choose which activity to do. Here we have to understand child cannot change the schedule that you provide, but he can make a choice from that, and he can only remove the visual schedule card once he has finished with the activity. So this is how you have to help him to go through this. Okay, we'll go for a recreating the whole things. What really we have to plan now? Having this pandemic in hand, what am I going to do? At home, keep the overall structure of the day as close as possible to an ordinary school day. Yes? So the structure should have a kind of flow as close as possible to an ordinary school. Example, keep meal times, bedtime, shower time at the same time, and establish zones in different areas of the home, like this is mom's or dad's workspace, this is study area for you, this is playroom. So have zones demarcated, like it has to be clearly specified for the child. This will have a structure in home. And one more thing we have to understand is help the child to nicely dressed up when he sits for the class, not in casuals, not in any form. He has to be properly dressed and then begin for learning. Create a daily schedule that loosely mirrors regular school day with built-in breaks for snacks, lunch and physical activity. See, we are mirroring so that the child has got kind of an understanding. Yeah, I have to, I'm bound to do. And use a monthly, weekly, or daily calendar to clarify the passage of time. Okay, my day one is done. I'm moving on to day two. I'm moving on to day three. A month is done. Okay, like earlier it used to be like Monday to Friday I go to school, Saturday, Sunday I'm at home, and then again Monday to Friday I go to school. Like there is kind of an understanding with school environment, coming home environment. Like there is a shift of place and shift of activities that they do, and they very well know what's going to happen next. But here with this current scenario where it is more unpredictable for the children, so we need to help them to even understand the passage of time through the calendar. And you can engage them with responsibilities at home. You can serving food, taking out garbage, loading machine, feeding the pet, or charging the mobiles, or watering plants, any kind of routine that a family has got inbuilt in their activities. This is where we have a point to say ecological inventory. An ecological inventory is very important to understand role or responsibilities family members have in their routine. When we understand the family routines at home, so we will know how many of them are at what time a particular person can pull out his time and give for the child to train. So we can share the responsibilities of the family members at home, as well as the child is also happily engaged during his class day hours, wakefulness hours. It's more meaningfully engaged, like not overloaded with one particular person. The schedule can have, like how we have different subject teachers coming to classes, right? So we'll have English teacher coming and teaching, and then science teacher, and person keeps changing. Same way, you can have your family members occupying, like helping the child to engage 1 hour. Another family member can come in and then engage for another hour. To have this being demarcated, we have to get into understanding the ecological inventory of the family as a whole. This is more valid when you are working with a high support needs children and multiple disability children, because children with having such a diverse need, they may have like a need that needs to be performed, which can be done through different modes. Say for example, you have a slot of doing a physiotherapy activities or physical activities as one slot, you can have any of the male members to be part of it. Okay, like that hour can be managed in such a way, the father or the grandfather or the brother who is available, has a free hour that time, can join the child and engage in such activities. Okay, so parents will look for ways to virtually connect the children with relatives. We think that we like only we must the social contacts. No, even children with special needs do enjoy when they meet with their relatives, classmates, or friends. Yeah, they have to have that social contacts. How can we provide in this point? We can give them through virtual connect. Yeah. Then consider establishing basic exercise routines. Yes, exercise routines is very important for them to refresh and also help them to have a healthy frame of body. Yes, so we have to have basic exercise routines. It can be yoga or it can be simple exercises. Yeah, here I have provided a sample of it. See, when we have discussed about designing an activity, so like we thought like we have to target a skill. Okay, take a skill as going to park. Okay, what do we do? Divide that into simple steps. See, there are simple steps that has been divided, starting from getting ready and back home with change of clothes and back to routine. Okay, so divide the skill into different sub skills. Having that done in a print form, and you have got two crosses mentioned in that, and then you have got substituted those word information into images. Yes, so this will be add on to children who have got more acquainted with the visuals. Like we know children with autism perceive better when they see than they hear. There are children with multiple disabilities who can perceive as a...
Sorry, madam.
Yes, please.
Excuse me, Anushya, madam.
Yes, please.
Sorry, madam, but your PPT is not visible.
Okay. Okay. Can you pin the pin it?
PPT is visible only, ma'am. Kindly pin Anushya Guruswamy presentation. It's there, ma'am.
Yeah. Thank you. Thank you. Thank you. Please, please. Yeah, I'll carry on. Yeah. Yeah.
Yeah, please.
Okay. Okay. So now you see, getting ready is one visual that has been provided, where there is a box on the top which says where you can put a tick mark there. Like, he can, if he is done with it, he can put a tick mark, or he can put a tick mark parallel to the print word where get ready is given. So like this is in substitution with the visuals. So this can be used with children who can read, who can follow the visuals that has been provided. So it's more clear with him what he has to do. And then coming out of house, he has to wear a mask, he has to sanitize, and hands needs to be kept folded, and social distancing is being demonstrated with image. And then how he has to use a staircase when he has to climb up or down. He has to either fold or put his hands into the pocket, and social distancing that needs to be maintained when he has to use a lift. And then how he has to use the mask. Even if he has to sneeze, he has to sneeze using a mask on. And then he has to avoid using a sitting on a bench. See, this is how you can, just a sample of it where you can develop for a visual schedule for one skill. Okay. Fine. Here I am going to talk about few things. Like I think some of the parents are part of it, and even the professionals can gain benefit by understanding this. This is just a key steps in helping myself in designing a activity schedule. Yes. So what we have to do first? Gather materials that you want to use while preparing a schedule. Okay, it can be scissor, glue stick, poster, or whatever it is. Then choose pictures for the schedule you wish to create. Keep in mind that a visual schedule helps children anticipate transitions and activities. It may outline parts of a day, half a day, or entire day. Cut your pictures. Mount on same size poster board. Keep in mind your child's development level in that. Laminate or cover the pictures with clear contact paper. Put a small piece of Velcro on the back center of each card. Use the same type of Velcro for the back of the pictures and the opposite type of the schedule board. Create a strip or a board to hold the pictures using poster board. Make it long enough to hold the pictures for several activities. Laminate and put the Velcro strip across or down the center. Okay. Put Velcro on backs of the pictures to attach a strip on the schedule. If needed, add a pocket at the end that represents finished or all done. Otherwise, pictures can be turned over to indicate all done. In case, a piece of Velcro goes on the front of the picture and the back. Tip. Schedule may be vertical or horizontal. Velcro the pictures to the schedule in order activities occur. Depending on the child, use only few pictures at a time or individually present the pictures to the child by pulling them off the schedule to show them. You can present it individually as well. Show the schedule to the child. This is very important. Orient the child to the schedule and model by hand over hand, touching or pulling off the pictures. Remove pictures for the child at the end of each activity and place in pocket or turn it over. Use the schedule. Keep the schedule near the child and at eye level so that he can view it as well as he can perform the task that has been given. Use the schedule as part of the class routine. Praise the child. This is more important. Reinforces a reward system has to go hand in hand by using the schedules. Add text to photographs. Text helps adults to use the same language. Yes. So when we know synonyms of many words, but we need to stick on to the vocabulary that the child is aware of. So such words can be put in the schedule so that it can help even one adult attending to the child, another adult comes and takes a turn, same language can be used uniformly. So the text can also go along with that. Present visuals from left to right if your child scans horizontally or top to bottom for a vertical scanners. The orientation depends on how the child scans. And thank you. I'm done with the session. Go to Revati, madam. Revati, madam, I'm done with my session.
Yes, ma'am. Yes, ma'am.
Thank you.
Ma'am. Once. So, thank you, ma'am, for sharing your expertise and experience with us.
You're most welcome.
The highlights of your presentation about multiple disabilities, their characteristics, how to support children, what support children require, and about the schedule part, and some suggestions about the modification using for the child in doing daily activities. Thank you once again, ma'am, and please stay connected with us for question and answer session, ma'am.
Sure, sure. Thank you.
Now I request Miss Bora Sai Lakshmi madam to introduce the next speaker. Handing over to you, ma'am. He's working as a lecturer, Department of Special Education in NEPMED.
Thank you, Revati. It's my immense pleasure to introduce Mrs. J. Vijayalakshmi, who is a former HOD of Department of Medical Science and Rehabilitation. To tell about Mrs. Dr. Vijayalakshmi madam, today is not enough. We can take many more days to tell about her. And it's a well-known fact that madam has been called as a mother of NIPMED and all the medical aspects of NIPMED. So it's my pleasure to introduce her. And because of the time constraint, we can say very short biograph of Dr. Vijayalakshmi madam. And she is actually a medical doctor who turned into a rehabilitation worker. It's a chief point in her life because due to her son who is a hearing impaired and trained in deafblind, and she trained her son and now he has actually he got married, and the one more important, most important point is he was he finished his PhD also. So the whole credit goes to Vijayalakshmi madam. Not only a mother, and more than that, being a rehabilitation professional, and as a doctor, she made her son to the sky. I can say about this, and this is all about. And she actually, madam has trained in many days, and she traveled across the world. She got trained in Netherlands for autism spectrum disorder and multiple disabilities. So she well acquainted with all the disabilities, and more than that, she always behaves like a mother. In 1.5 years my service in NIPMED, I could I could say about, and I tell Vijayalakshmi madam that she is like a mother actually, as far as my concern, my experience concerned. So it's my great pleasure to introduce Dr. Vijayalakshmi ma'am. Thank you, ma'am.
Good morning, all. Can you hear me? Revati? Revati?
Yes, ma'am, we are hearing you.
My
Yes,
slide
ma'am.
is visible, no?
Yes, ma'am.
Yeah.
Yes, ma'am. It is
Yeah,
visible, ma'am.
respected Director Sri Nachiketa sir, respected Chief Guest Jayachandran sir, Kamraj sir, the Head of Education, my previous person, Mrs. Anasuya, and all the faculties of special education and all ethnic men. Good morning to one and all of you. I'm so happy that you have given me a chance to present my talk on sleep schedule for children with multiple disabilities. And I want to tell you, I'm going to start off the talk. Sleep, is a cycle. Actually, we are keeping awake and also going to sleep because of a rhythm called a circadian rhythm in our body. So this rhythm is actually keeping us awake, actually, not the sleep, but it is keeping us awake. And this is controlled by a hormone called melatonin, which is secreted by the pineal gland in the brain. So melatonin is the hormone that is secreted by the pineal gland in the brain, and that helps to control the circadian rhythm. Actually, the circadian rhythm is yes.
Ma'am, your screen is visible, ma'am, but little clarity is not there, ma'am. But we can hear you, ma'am.
Can you now the clarity is there?
Ma'am, we are missing some details, ma'am.
Okay. Now.
And we couldn't able to see your face also, ma'am.
Okay, now is it visible?
Yes, ma'am. Yes.
The screen is
yes,
fully
ma'am.
visible.
Yes, ma'am.
Is it okay? Now is it visible?
Ma'am, not much clarity is not there, ma'am.
Okay. Now it is there. Now let me see whether this is visible.
Is it PowerPoint, ma'am?
Yeah, it is visible now.
Ma'am, we couldn't able to see, ma'am. It's blurred. We couldn't see, ma'am. Ma'am, can you share PPT with me, ma'am? I'll do that there. Yes, ma'am. In WhatsApp also? Yes, ma'am.
Now.
Yes, ma'am.
Debbie, can you see this now?
1 second, ma'am. Ma'am, no, ma'am.
Is it blurred now?
Yes, ma'am. Yes. Ma'am,
okay.
Send.
You're sending. It's not going. That's why I couldn't send you.
Okay, ma'am.
Is it so much blurred?
Ma'am, can you WhatsApp otherwise, ma'am?
Okay. Yeah. Who is the next speaker there? You want me to?
Gauri, madam, ma'am.
Can I do afterward then?
Shall I ask, ma'am? Then
she may not be. She may be having a client, Is it okay? Can you see?
One answer. No, ma'am. No, ma'am. Ma'am, if we don't be visible, ma'am. You send it to WhatsApp, ma'am. Ma'am, you please send it to my WhatsApp number or email, ma'am.
Yeah.
Ma'am, you just give us present screen over there, ma'am. In your screen, present now option is there, no, ma'am? Can you? Yeah. Yeah. சொல்லு. வெளியவே ப்ரெசன்ட் போட்டுருக்காங்க. அதான் சொல்றாங்க. உங்க வாட்ஸ்அப் அனுப்புனா கூட நான் எடுத்து போட்டுருவேன். எதுக்கும் அவங்க ரெடியா இருக்காங்களாமா, லைன்ல தான். ஹலோ,
இப்ப தெரியுதா?
மேம் அது பண்ண முடியாது மேம். அது ரொம்ப கஷ்டமா இருக்கும் மேம். கிளாரிட்டி வராது மேம்.
ஓகே, அப்ப சரி. அப்ப
ஸ்கிரீன் ஷேர் பண்ணுங்க மேம். இல்ல மேம், அந்த கீழே இருக்கும் பாருங்க மேம். உங்க கூகுள் மீட் ஓபன் பண்ணுங்க மேம்.
அது பிரசன்ட் ஆக மாட்டேங்கிறது. ஸோ டைம் போறது, அதனால தெரியுதா?
ஓகே மேம்.
இப்ப தெரியுதா? இப்ப
மேம்
clear
அது
இல்லையா?
ரொம்ப கிளாரிட்டியா இல்ல மேம். மேம் ரொம்ப கிளாரிட்டியா இல்லையே மேம். ஆனா
இல்லையா? இப்ப
எஸ் மேம். என்ன பண்ணலாம்?
இல்லையா? தெரியுதா?
மேம் we couldn't able to see you மேம். பட் நீங்க பேசுங்க மேம். we
Okay,
can
okay, okay.
listen
Yeah,
to you மேம்.
yeah, okay. So there is
Yes
a
ma'am.
circadian
Yes.
rhythm.
Yeah, please ma'am.
There is a circadian rhythm in the human body, and this is controlled by the hormone melatonin. So melatonin is secreted by the pineal gland in the brain. So actually there is a drive, and that drive is by, we have a sleep drive, and that comes from this. And the actually the circadian rhythm is the sleep awake mechanism, and it helps us to be awake, actually, to get up fast. So when the light falls on us,
சர்ஜரி முடிஞ்சு
the light falls on uh, the light falls on the eyes, it is taken to the pineal gland and it secretes melatonin. And this melatonin is actually controlling our circadian rhythm. So the internal clock has to synchronize with the environmental clock. So we start sleeping at 10 and we get up at 6 o'clock or 5 o'clock. And this is because the internal clock is synchronizing the environmental clock. And there is in children, there is a strong drive for the uh, sleep to occur. The sleep drive makes the child to go into deep sleep. So there are 4 stages of sleep. Stage 1, when we go to sleep, when we start sleeping, the body movement reduces. And stage 2, the person's brain waves slow down. And stage 3, the deep sleep sets in. And then after the deep sleep, we get up. So this one cycle is about 90 to 120 minutes. And this stage 1, 2, 3, 4, like that, it happens all throughout the sleep cycle. Am I clear, Revati? Are you able to hear me at least?
Yes ma'am. Yes ma'am.
Yeah, okay,
Ma'am,
thank you.
Please proceed ma'am.
Okay. So you have to make a very good sleep schedule, because you give it at 7:30. If you are fixing it up at 7:30, give a mild, warm, lukewarm water bath and massage with powder. Give food, tell stories, sing a song, and put a mother's saree around and put the child to the sideline position and make the child sleep. Actually, when you want to make the child sleep, actually you should teach the child to sleep. That is the mechanism. Because we are teaching the children to sleep. The child has to be taught that there is a fixed time for him to sleep, and he should get up at the present particular time. So for that, for deaf-blind children, I have seen mothers making use of the pillow to indicate the time to bed, and the pillow, they keep it in the schedule box, a small pillow, and then the child is shown the small pillow, and then the child takes up the pillow. The mother and the child takes up the pillow and go to sleep actually. So this is what is happening with the children with deaf blindness, because they need an object to communicate and to have a scheduled time. But it is all the time, the child may not sleep for the amount of time required by the child. So the child has to sleep for 9 to 10 hours, means the child may not sleep. Sometimes children with autism may not sleep. So even if you schedule this, there are problems, and we should avoid those problems when the children are actually going to sleep. We should analyze their sleep and find out why our child is not sleeping. We found that we did a research in NIPMED. The 45 children were studied for sleep disorders, and about between the age of 3 to 15. And if we found that 45 out of the 45 children, there were 9 children, they got up in between because they were hungry. And other 2 children, the 2 children, they really had problems with restless leg syndrome. They were always having moving their legs and sleeping. So they were disturbed very often. And around 20 of them, around 20 of them had snoring problem. That is, when they are sleeping, they are snoring. So that was the problem we detected. And and also the child, who was not fed properly. And children, because the child is a CP child, the feeding is really difficult, and the child's stomach was not full. And so the child was getting hungry all the time when the child is put to sleep. So though you schedule a mild water bath and warm water bath, a massage with the powder, give the food, tell stories, or sing a nice song and all, and use mother's sari, because mother's sari has got the pheromone from the mother that will help the child to recognize the mother. So even if the mother gets away from the child will continue to sleep. Even if it is a big child, use it for as a bed cover, because mother's sari really has the pheromones of the mother in the sari. So why some children, we should always analyze why there is a deviation from the normal. Some children are snoring, and because they have allergic rhinitis, that is, they'll be having cold, always the upper respiratory tract, that is the nostril, the oropharynx, nasopharynx, oropharynx, they are all oral cavity, they are all inflamed because there is infection due to a virus. So there is allergic inflammation, and that is called allergic rhinitis. Yeah. Yes.
Ma'am, we love to see your face, ma'am. Ma'am,
Okay.
screen is not
Visible.
we can see your face, ma'am. Please show your face to us, ma'am.
This is coming, no? My presentation is coming, no? You are able to see my slide? Not very clear.
Yes, ma'am, but the clarity is, yes, ma'am, it is very unclear.
Okay. So I'll present my face at the end, yeah. I'm just sitting opposite to the screen so that I can.
Okay.
So.
Okay, ma'am, okay.
Okay. So the child snoring, snoring of the child is really affecting the sleep, because many children, our children are having allergy, and they, while going to sleep, they will be having cold, and the nostrils are filled with secretions. It may be a viral infection, or it may be allergy to dust, or allergy to the soap you use, or allergy to the food you have given. So the food itself is a factor for allergic rhinitis. Sometimes some children are allergic to coconut oil. Some children are allergic to dal. Some children are allergic to brinjal. So anything you give suddenly, some are allergic to gluten in the chapati. Suppose you are giving chapati in the night and the child is immediately developing a cold. You can see that the allergic rhinitis is due to the allergy that has been produced due to the food, or due to the dust, or due to the smell, or due to the flavoring agent you have used in the food, or it may be the oil that you have used in the food. So in children with autism, the allergy can cause lots of problems, because that is the reason why they are not able to sleep properly. Many of them have not running cold, but they have problems with the breathing and having a sound sleep. So when the breathing through the nose is difficult, the child will start breathing through the mouth. So if the child has got enlarged tonsils and adenoids, these are the lymph node. The adenoids are the lymph nodes in the behind the nose, inside the throat. So that will obstruct the airway. That also causes snoring. Snoring is not good for sleep, because it can cause a lot of problem. So one is allergy. Next is, there are children when they are born with cleft palate, then they will have difficulty in breathing and they can snore or aspirate. So they will not be able to sleep properly. That is why children who are born with cleft palate, the cleft is repaired immediately, they will try to repair it within a year of time, because there is difficulty in free feeding and difficulty in breathing and difficulty in sleeping. And now then craniofacial anomalies, abnormalities. Some children will have, flat skull. And this may be due to some drug taken by the mother during pregnancy. So their features are so different. The lower jaw may be protruding. So that is called the cranium. The skull and the face are not fitting in properly. There are a lot of abnormality in fitting of the bones. So that can occur as if the mother has taken some drugs during pregnancy, especially if the mother is also epileptic, she'll be taking drugs for seizures, and that can cause difficulty in development of the bones. So the bones are not developed properly, and it can go into craniofacial abnormalities. Then the opening of the nostril into the throat, that is called choana. That region is called choana. And that choana is obstructed in syndromes like CHARGE, which is a cause for deafblind children. Deafblindness, the syndrome, that is becoming now very common now. Even without CHARGE, deafblindness, children are born with choanal atresia. That is, the opening of the nostril into the throat is not seen in some children. So they will breathe through the mouth, and during sleep, they snore a lot. Then you have the gastroesophageal reflex, because the acid comes up from the stomach and it goes into the esophagus. And that is a very difficult situation. And this is what is occurring in many children with multiple disabilities and autism spectrum disorders. It is an unseen reflex, You cannot find out from the child. If the child is a talking child, then only you can find out that there is a reflex from the stomach to the esophagus. That is the food pipe. From the stomach, the acid and food comes into the food pipe during sleep. So that is called gastroesophageal reflex, which is a very severe problem. The food and food will get collected, acid will get collected in the throat, and the child may snore, and the child will not be able to sleep. There will be severe pain, chest pain will be there, And this is a very difficult situation as far as a child with gastroesophageal reflux is concerned. There are many children in our school itself having a gastroesophageal reflux. Then what happens in snoring is the upper respiratory muscles are become loose, and the small tongue, the uvula and soft palate become very loose, and it obstructs the airway, and you hear a sound. When you are sleeping, their sound is coming. So when there is reduced airflow through the air tract, the carbon dioxide level will go up, and the child will stop breathing, and this is called apnea. This is called sleep apnea, APNOEA. So snoring will produce apnea, APNOEA, apnea, and sleep apnea, if it occurs many times, it can cause brain damage, heart damage, and heart may even stop, and the child may die. And fits can also occur. So sleep apnea is one of the major problems of snoring. That is why our children are not sleeping well. Some children, when they are not sleeping well because they have difficulty in actually the airway being narrowed. So the air is not getting in properly. And also we have children who have obesity. The children are very obese. There also you get the soft palate and uvula are very loose when you are sleeping. So what you have to do is, you have to do a investigation called polysomnography. POLYSOMNOGRAPHY. That is, recording of sleep is done. The child is asked to come to the lab at 7, and when the child starts sleeping, before that they put in electrodes, and the child will be allowed to sleep. The child has to have a normal sleep, and that is recorded. How many times the child developed apnea, and how many times the child got up, everything will be recorded, and waves will be coming. They study the waves and the percentage of oxygen, percentage of carbon dioxide in the blood of the child. All this are noticed during sleep. Then if the child is having jaundice, then the sleep pattern is altered. So the liver function is very important. You have to do the blood test for liver function if the child has jaundice. Because when the child is having jaundice, the child will have reversal of sleep. He will sleep during day and he will not sleep during night. Then you have to do a bronchoscopy. That is, you have to analyze from the nose to the lungs. They put a scope and see whether how many abnormalities are there while the child is not sleeping. And of course, endoscopy, gastroscopy for finding out the esophageal reflex, gastroesophageal reflex. So you avoid junk food, and you must have an elimination chart, and before going to bed, you must have the bowel and bladder eliminated. And you do not give screen time. Don't allow the child to play with the mobile before going to sleep. And the room should be sound free. The light has to be controlled. Some children sleep with small light, 0 watts lamp can be put in, because they may have fear of shadows. So they won't sleep, There are children who are telling that shadows are seen, so we are not able to sleep. So you must avoid shadows, and you should make the child go to bed early. If the child is already on treatment for seizures and sleep, that should be given at the correct time. It may be that the doctor might have told them to give the medicine at 8 o'clock. So give the medicine only at 8. Don't give before 8 or after 8, because the blood level has to be maintained. So bedwetting has to be examined. You have to see whether the child is passing urine during sleep. Sometimes the child may have worms in the anus. So the child will be scratching and getting up. Sometimes the child may have irritation of the eye. The child will have dandruff in the hair. So dandruff in the hair, dandruff in the eyelids. So that has to be cleaned. The child's dandruff has to be cleaned with warm water. Deworming has to be done. And all these will lead to sleep hygiene. So there should be a quiet environment, and children have to be taught to sleep at a particular time. Even then, the child with ASD may have difficulty in going to sleep. And video recording of the sleep will help you to know lot of things from the how the child is sleeping, whether the child is moving their leg, whether the child is getting seizures and not sleeping, whether they have harmless jerks during sleeping or sudden shouting behaviors during sleep. And all these are to be taken into account when the child is put for sleep. So think of the touch me not plant. There is a plant called touch me not, and when you touch it will close actually. But usually if you don't touch, during evening, when there is no light, it goes to sleep. So a comfortable environment, a comfortable light and comfortable amount of food is needed, and there should not be any allergy for us to sleep well. Thank you, ma'am. I give back to Revati, ma'am.
Yes, ma'am.
Yeah.
Yeah. Thank you, ma'am. Thank you very much, ma'am. It was wonderful session about planning sleep schedule or no unhealthy sleep habits. So you are pointed out the difficulties faced by children with multiple disabilities, deaf blindness, and given lot of suggestions to follow. So I hope parents will definitely take all your messages. Your sharing is very valuable to us, ma'am. So I would like to comment that wherever you are, ma'am, whatever you do, we feel like we did something. Such a feeling with you, ma'am. Please, yeah, yes, ma'am. Please stay connected with us, ma'am, till the end.
Yeah.
So we'll also have a question and answer session, ma'am. Thank you, ma'am.
Thank you.
Yes, ma'am. So now we have next speaker to introduce Dr. M. Karpasamy, Assistant Professor, Department of Special Education, NIPMET. So it's over to you, sir. Please proceed, sir.
Thank you, ma'am. Thank you, Dr. Reddy, madam. Now I invite this session, Mrs. Sri Gauri Ramachandran, Rajesh Ramachandran. He is very excellent clinical psychologist as well as a special educator. Now she is positioning consultant clinical psychologist, the Department of Clinical Psychology, NIPMET. She is graduated in Bachelor of Degree in National Institute for Empowerment of Persons with Multiple Disability and specialized in the field of special education. She is acted as a good clinical psychologist. She has a 14 years experience in the field of rehabilitations in the area of cerebral palsy, intellectual disability, autism spectrum disorder, and multiple disability, and consulted with is the best in the behavior modification therapy for in the field psychology, and she guiding more parents for involved in the reduce the problem behavior. And she completed B.Ed in the field of special education, and she have involved in the tele-counseling for the parents to beginning the days of lockdown, and she supported to many parent groups and many faculty groups, and she wrote some author of some books. She published many journals in the reputed journals, and acted as a resource person in different CRE program and RCA recognized courses. She is a member of various projects in the Department of Clinical Psychology. She is guiding to the students for it completed their research activities in the field of psychology. So I would like to invite in this session Mrs. Gauri Madam to share your knowledge in our audience for participants. They are get more benefit from your intellectual sharing. Thank you, ma'am.
Thank you so much, Karpasamy sir, for your wonderful introduction about me. Member of this webinar and education, the faculties of education, and also thank the director for giving this opportunity to present such a wonderful topic on daily This is it's my privilege to share this platform with my good children. It's a huge privilege to me, sir. Thank you for being here and sharing for your expertise and knowledge in this area. With this, I and hello. Yeah. I'd also like to bring all the participants and faculty members of the session.
Ma'am, ma'am
Yes.
Gauri, ma'am.
Is my voice audible? Yes.
Ma'am, voice is breaking, ma'am. Hello.
Okay. Now, ma'am. Ma'am, now.
Yeah. Yes, ma'am. Yes, ma'am.
Okay.
Yeah.
Yeah. Yes. Now, ma'am, is it clear? It's still
Yes, ma'am. Now it is clear, ma'am.
Okay, I turned off my video. So, shall I start the screen?
Please do, ma'am.
Yes.
சீதா மேம், இங்க கேமரா இருக்கு பாருங்க. இங்க என்ன இங்க இருக்கு பாருங்க. என்ன உங்களுக்கு வரல? இங்க வர்றாங்களா? இங்க வர சொல்லுங்க. என்னன்னு சொல்றது? ஏன் இங்க வந்துட்டாங்களா? கீழே கிடைக்காது. ஓகே. Yes, madam will join in a minute. Sorry for the inconvenience due to network issues. pen drive la copy பண்ணாம Participants, please stay on and please mute your webcam for better bandwidth management. Madam, delay connect பண்ணிதான் இருக்கு. நான் பண்ணவா? நான் பண்ணவா? அந்த பேப்பர் எனக்கு கொஞ்சம் தெரியல. Mm. ஏதாவது நான் இப்போதான் ஓபன் பண்றேன் நான். Hello, Vasuki Devi ma'am. Please don't present your screen. Please check so that we can share our screen. Miss Vasuki Devi. Ready ஆயிடுச்சா? வேற யாரோ ஷேர் பண்ணிட்டாங்க. வாசுகி தேவி மேம் ப்ளீஸ் டோன்ட் ஷேர் யுவர் ஸ்கிரீன். நான் பிரசன்ட் பண்ணேன். So sorry for the inconvenience. So due to network issues, so let me start my presentation. I'm Revati, working as a lecturer in special education department in MED. So I'm going to talk on creating learning opportunities for children with multiple disabilities, autism spectrum disorder at home during this COVID pandemic. So let me start my presentation with little introduction about multiple disabilities and autism spectrum disorder. So as we all know, according to Rights of Persons with Disabilities Act, multiple disabilities refers to more than one specified disabilities that is the combination of two or more disabilities. It could be visual impairment and intellectual disability. It could be hearing impairment, cerebral palsy, or it could be intellectual disability, cerebral palsy, and visual impairment. So we need to understand that all multiple disabilities are not same. We need to understand the three things: that how many disability a child has, that is two disability or three disability, which disabilities are involved, and how severe each disability is. So which disabilities are involved is whether it is locomotor disability or hearing impairment or visual impairment or ID. So which disabilities are involved? So that we need to understand with. And so talking about here about autism spectrum disorder is a lifelong developmental disability or neuropsychological disability. May have children may have uneven skill of development. You can find their physical cognitive skill might be normal along among the children with autism spectrum disorder. And autism spectrum disorder is primarily affecting the communication and social abilities of a person, marked by the repetitive and ritualistic behavior. So this is what a child with multiple disabilities and autism spectrum disorder. So parents and special educators, and therapists, children require special education, inclusive school education, therapeutic services such as physiotherapies, occupation therapy, speech language therapy, and behavior modification. So now during this lockdown, it is happening like online, offline learning. Online learning with using WhatsApp video call or Google Meet or other Zoom or any other platform. And offline, if we see pre-recorded video and task will be given for the child to do the activity, and that will be sent to the special educator. So this is the thing right now it is happening. And therapeutic services through teletherapy and behavior modification that is taken through telecounseling. So all that should follow a transdisciplinary model. And I'm here to say parents and special educator having a sharing responsibility. Yes. So educational program of children with multiple disabilities and autism spectrum disorder, we need to consider the three components. If the child is studying in inclusive education or special education in the mainstreaming school along with non-disabled children, then therapeutic intervention with child requiring, and curriculum plans according to the educational needs of the child. So reading and math. So here I am going to discuss about what educational activities for children with multiple disabilities and autism spectrum disorder. And then I will talk about how to create a learning opportunities for the child. Yes. So reading and math is core academic skill. Is one of the core academic skills throughout the world, and this should be given most priority. And children, it is most important for children to learn the skill. It is required for the children. We need to help the children. It helps the children to perform daily living activities such as shape, like shopping, cooking, banking, and other household activities. Basic concepts. So basic concepts we will that and all very important for children, any children with disabilities. To overcome reading and math difficulties, there are general things that we need to consider. We need to identify what are the difficulties of the child. having disability and also in the learning areas. So identify the signs and symptoms of the child. Always we need to create a supportive environment that help the child changing attitude, motivation, and building a confidence with the child, scheduled with short breaks. That here our task is like child cannot sustain for a long period of learning, so we can schedule into a short breaks, positive reinforcement, and some specific strategies if it is that will be most helpful for the child. So we can use a specific strategies like step by step approach, a guided strategy. If the child is in inclusive school, we can also think about peer learning, collaborative learning, and so on. So we have basic activities. When the child comes in, we will see whether the child is able to perform the basic concepts like identifying uh, alphabets, fruits, birds, animals, vehicles, no, around the environment like hospital, school, flowers, and body parts, uh, climate, weather, and so on. Shapes also, color, size. So all that basic concept we need to check whether the child is showing the progress. So once this is done in the beginning years of 3 years, then we can no we can think about to enhance the reading skills of the child. So when coming to enhance the reading skills of the child, letter identification is the identification is the first thing that will help the child to enhance the reading skills. Identifying and naming the pictures. So here in an example, there are pictures like balloon, butterfly, ball, banana, bus, and so on. So the child will help the child to learn and know, identify and name the pictures, identify letters, and identify the letter and sound correspondence. So we need to use VACT method, that is visual, auditory, kinesthetic, tactile method. So for example of letter identification, that can be given to the child to trace the letter using sand or salt. So we have other concepts that we need to focus like day, night. We are at lockdown and at home, so we can talk little bit. We can make them to learn, understand about the day and night and days of a week and so on. And there are children who having deaf blindness, then or blindness. Then we need to think about the sensory organs. So that smell, taste, whether that the child is able to understand the concepts. So we have autistic children, they might have sensory issues. So rough and hard, that can also be addressed. So we need to start with the reading skills. Once the reading skills, the child is identifying pictures and letters, that is what this phonemic awareness it goes. So phonemic awareness is letters that the child need to identify, and the child need to able to produce the sound correspondence. So for example, like F, K, M, R, W, B, Z. So small letters is, and a mixing of letters is given for the child. The child may ask to find the letter and tell the sound of the letter. So that can be using flashcard. You can use repeated rehearsal of the child. So one chord and another, make the child to understand, make the child to follow the concept. So then word recognition is another stage. Once the child reaches the phonemic awareness, we can move, we can take the child to the word reading. Word reading, which includes if the child aware of the letter sound correspondence, like for example cat, mat, pat. So the sound will also be taught to the child. Here I have using the blending and decoding. Here I have an example. There are three boxes. There are three boxes in which sun, three sound boxes. One letter will go in one sound box. So if you see, S is written in the first sound box, and U is in the second, and N is in the third box. So like we can teach them, we can use tapping also. You can tap 3 times to make them to understand the letter sun. We can also tell them to write in the box, like using this sound box. We ask them to write in the box. If the letter is more than 3 letters, 4 letter, we can use the same method. If letter is 7, 8 letters, then we can go for syllabication. So the next is, once the child making progress, we can move to short stories, that is oral reading passages. Oral reading passage. So a passage will be given to the child. So we know that we have Panchatantra stories that can be given, and the child may ask to read the picture, read the story, and then we can make a questions and make them to understand. So here we have published a paper on using a method called direct instruction, making them to learn on the making them to understand the intervention was given to the children to learn phonemic awareness, word recognition, and 2 to 3 letter word recognition and short stories. So that was given to the child. Over that, you can see the direct instruction method, which involves acting as a model, guided practice, and individual practice step. So we'll be modeling to the child. For example, if a letter is there, so F, so that we can model to the child, it should be produced as F, and sound is F. Then guided practice, we can ask the child that we do concept, and we can make the child to do independently. So here I have given in a tabular column, you can see, and the methodology part you can see. The children with lower KG is having a 6-year-old child studying in mainstreaming school, above 120 average intellectual functioning, and was reported mild autistic disorder, having difficulty in sustaining the attention. The problem with the child is attention, and there is no the child continuous reading, though a child was taken. And another child, if you see, 4th grade child, 8-year-old student studying in mainstreaming school, and according to the intelligence quotient was determined to be 62. And this oral reading test was administered with the child, and the child was reading skills at 1 grade level. So another child, the same thing, like 15-year-old child studying 8th grade. So the child is also could not able to identify even alphabet letters. So the 4th child is 2nd grade, 7-year-old child, having no lower grade level, difficulty in sustaining attention. So you can see the progress of the child on the pre-test and post-test, how the child is improving the progress. So lower KG child, that is 21 words was correct, and then the following post-test it was 51. We have corrected them. So all the children is making some progress. So what I come to say, point to here is the phonemic awareness help the children to read and write 3 to 4 letter, that is CVC and CVCC words. That is CVC is consonant, vowel, consonant. That is rat. If you see example, consonant, A is vowel and T is consonant. So the blending and decoding was achieved by repeated readings using the instruction. So the another point I'd like to point here is sample or having different learning style and competency, but the direct instruction proves to be significant. So once if we practice with that, if the child is older, we can think of the sight words also. So for children who can read sight words may be a better thing instruction for the child. The child should not spell out each by letter. The child can look and say whole word reading approach. So for example, words like I, can, come, me, go, you. So we have adults sight words also. You can Google it and search of. So that is printable flashcards for sight words also. We can print it and give it the child. Once you sit with the child, make them to read, model it for them, so the child will learn. You can also tap. You can also tap by making them to learn. All that can be done. So another thing is ask child to read a passage, grade level passage, 1 minute, and ask them an answer for comprehension question. So it can be Tamil, it can be English also, Hindi, whatever language you want. You can give the child, make the child to read if the child is making, if the child is able to. So another, if the child is not, the one thing I wanted to say, the other thing that if the child not able to read, we can use of uh, assistive devices. We can make them to write. If the child is not able to hear, we can ask them to write using the story started. We can give a picture to the child. We can ask the child to write, or you can use a narrative prompt. Narrative prompt is like, if I tell, once we went to a school, and so I'll stop there and the child will continue that. So, or we can go for expository prompt also, just by giving a word to the child, make the child to talk about or write about. So it's like about your family or school, the child will write. So this is all about, there are so many strategies, but the basic important thing that we as a parents can follow at this lockdown also, that is what the 2 3 things I have mentioned here. So we have math activities that we can do at home. So there are a lot of activities that we can do at home for math. So math concepts, which includes number sense, counting, naming numbers, place value, greater than, less than, or equal to, and many things are there. Yes. So the home based activities, shapes is one that using Dove Ata, that we can make them to create, and children, they know it's like a fun activity for children to learn. And whatever objects we have at home, using that we can ask the child to sorting according to the color and size and so on. So this is another activity like number identification and counting, for make them to understand the number sense. So number sense is what numbers sense to them. So like it is, if the child recites 1 2 3, he is learning the names of numbers. He also learn the numbers in a fixed order. Like no, tell us about, once they count 4 or 5, and they can should tell us the last number, no, that what telling the quantity. 5 is the quantity if we count from 1 2 3 4. So here a picture, a child, there are two ways that we can make, like 1 2 3 4 5, there is 2 card is missing, where the child picked up the card and kept it in near the block, because the 2 blocks is given. So then the other way we can do is like 4 blocks is given, and the child need to pick up from the flashcard 1 2 3 4 5, the number flashcard. The child need to count and uh, uh, pick up the flashcard. Then another that home activities is like fun to have Ludo play, playing Ludo, snake and ladder game at the home. And the Max is also like they can understand the weather, and that helps them to understand the time concepts, right? So all right, right. Then we have another concepts that we can teach to the child, like place value. Place value is fundamental concept, and make them to, and it is tricky also. But once the child, if you know catch, then the child will easy to use. We can use like paper cutouts, graph paper sheets that can be cut into ones, tens and hundreds, and we can use abacus, and greater than, less than, we can tell a story like big mouth of crocodile, eats more number of fishes or something. Then time is also important. Take the child for outing and make them to understand the difference of morning, evening, and so on. Capacity that we can give, like small activity, telling that you can ask the child to bring some bottles of water and see what makes the differences. So then ascending and descending order that we can use at home by stepping up and stepping down, that can be used, taught to the child. Money is also important concepts, because we can begin with coins and rupee, and then we can move on for the child to learn the concepts. Dice is also here. We can use dice to play while playing Ludo and all. We can make them to learn. So this is at the beginning years. If we taught the child, you can see the picture in the screen that child is computing using fingers from maybe what the number is given. So this will this will help or not, that we need to consider, because they will struggle after 10 because they don't have fingers in the hand. So rather we can focus on mental math. For example, 2 plus 3, 2 in the mind, as we do in our days, 7 in the finger. After do count till 7, and finally what the child is getting, that will be the number. So we can also use these kind of small activities for the child, like 0 plus 0, 0 plus 1, 1 plus 0, 2 plus 0. You can mix up and you can start with small number and increase it and go to the bigger number. And subtraction is another concept, takeaway concept. You can use numbers like for understanding the concept. So some specific strategies that we can use with children with multiple disabilities. This is one, like concrete representational abstract strategies applicable for all children. So this method is used throughout the research, throughout the many researchers have done using this approach. Concrete instruction is like learning them through hands-on manipulation using concepts and procedures. We can provide a lot of manipulatives like blocks, beads, stakes, and so on, to calculate and to compute, understand the concepts with the hands-on manipulation. After the child learns the concepts concretely, learning that should happen through a pictorial representation. We can move it on, and a significant time should be spent on the learning part, that is what concrete part and pictorial part, and eventually student learn and instruction should focus on abstract symbols. So this problem solving, the technique is like immediately we can give the feedback to the child, and we can drill and practice the child. Next is about math vocabulary. So math vocabulary is one of the best, because best starting point if your child is learning the concepts, because it is similar like learning arts, like learning language. So what we will do, before plugging into before starting the lesson, you can give the students to give an opportunity to learn the important words and phrases. So for example, if you wanted to teach a particular concept, that concepts, like here it is given shapes, that concept is written in the word wall. So a display chart is for that activity, a display chart is placed on the wall, or like arranged in an alphabetic order. You can see that large visible letters on a wall, bulletin board or something we can display in the classroom, so that the child will understand. So this is the vocabulary, add, subtracts, and so on, can be taught using the maths vocabulary. Why it is important is we have words like add, sum, total, so the child will get confused sometimes, so we need to make sure the child, whether the child is understanding the concepts. So next is one such technique with works with autistic spectrum disorder. So this touch math is a multi-sensory approach for basic computational math skills. So touch math is with the child student is seeing, touching and saying and hearing. So each digit. So student achievement in basic computation will be higher than the other students. So this is what touch math approach. You can see the picture. So each digit numbers 1 to 9. So with the touch point that matches within the numerical values of the digit. So 1 to 5 have a single touch point. So and you see the sixth digit have double touch points represented by dot inside the circle. So touch points or no, if the child touch and write. So one, the child need to touch once and write. For 6, the child need to touch 1, 2, 3, 4, 5, 6, and the child needs to write. So it is very helpful for the child to learn math. And if children having non-verbal some children with autism spectrum disorder having non-verbal thing, then the child can use this kind. So mental math can also be encouraged with the child. We can give every day a checklist for 3 minutes or 5 minutes depending upon the child required. So whether the child is able to do at least to 3 one digit addition, then you can give the time up to 3 or 5 minutes which comfortable for the child. So sometimes it need adaptations also, so that will also need to be considered. So next, there is one more strategies, explicit strategy instruction. So where a child will helps the child to learn skills and engage them in thinking about how to perform a complex task. So we have 4 stages like explain, I do, we do, you do. Explain is tell your students what strategy they will be using and which and why it is important. So explain to the child, it just explain, provide learners that something like note, and model the skill using think aloud, or both can read. And I will do the child and make the child see that. So that is I do. We do is both together can do, and you do is allowing the child to practice independently, and you need to monitor and give the feedback. So next, these are some specific strategies I have mentioned, and I have also told that some strategies we need to keep it in mind while planning an educational activities for the child. If you need to find the no find out identify the strength of the child, you can use IEP, or you can know if special educator, they can ask the parents and identify the strength of the child. So meaningful, so once you identify the strength of the child, provide a meaningful and interesting experiences to the child. So very concrete experiences, let the child spare the time and learn meaningfully. So making choices, because we can't make the child for a long time, and there is also distractions with the child, and the child may not be interested to perform the activity. So in a time we can make choices for the child whether you are interested to do this activity or that activity. So next is what practice and reinforce. Practice and reinforce is as many as providing no concrete and consistent experiences. Concrete is practicing with the child repeatedly and consistently, so and reinforcing the child, which helps a lot. So next, this modification accommodation, wherever the child require modification in the content, in the material, in the process, in the method, that should be taken into consideration. And the child may, if the child is having 3 years old or 4 years, 5 years, whatever the age may be, but assistive technology, that transition can be start in the earlier years of age, so that the child learn to use the technology, and the technology supports a lot for the child for the later years. So it should follow a transdisciplinary team approach, since the child is getting services from therapeutic behavior and so on. So task analysis, that as a special educator, plan for task analysis, think about the individualized IEP plan. According to that, if provided in a structured manner, age appropriately, then definitely the strategies will help the child. So parents, now the other area I mentioned about how I can create learning opportunities for my child as a parent. So parents might be thinking what I can do, how I can support my child to the best. I have some strategies for you. We may, okay, we need to know the three things before we start. That is what a routine, schedule. That is Anushya ma'am was talking about the wheels tools and I think we can plan a child. There is Khan Academy daily schedule is available in the website. How to plan the daily schedule for every day, and setting up the behavior part for the child, what you are expecting from the child on every day, that should be setting. And another important is setting a learning space at home for the children. So setting a learning space at home for the children is, that is, create a space, a learning space where children can work without distraction of TV, electronic devices, watching from through window, looking around pets, if any, or if any other child is playing at home. So that needs to be taken care. If you have two children, then we need to think of separate rooms. One can work in kitchen, another can sit in a different room. Different timings that can also be followed. If we have two children, we can also, like in a table, we can use a divider and make them sit apart and learn. So routine and schedule is very important for the child. So when your child helps to create a routine schedule, if the child has difficulties, give them choices about what activities, and ask them to follow the schedule. So remember always that every child is different, right? Some children are constantly like moving one place to another place. Some are quite doing in one activities. Some they are follow the structure routine, and some prefers that their own schedule. So some do the activities, some they struggle, and we need to help a lot for the child. So children with multiple disabilities or autism spectrum disorder may need help. So they need help, they need some level of support and assistance throughout their lives, so that the amount of help that would that the child needs depending on the disabilities involved. So the three things we have, I have listed, like creating schedule and provide them an encouragement that we are going to do this activity today. Can we do it right now, or can we do it in the evening? Lot of encouragement and interaction with the child, and then the child is slowly ask the child to join to the activity. Talk to the child every day, ask some questions, or whatever the questions they have, answer to that questions. So the child, so during this lockdown period, they may have questions like why we are at home. This is our many webinars and other things have talked about this so much. So what activities we need to do, and I am like missing my brother or something, like relative or grandma, that all those feelings, so that emotional and social support the child may require. So talk to the child every day. So another thing that about for parents and teachers, stay connected with a special school and inclusive school, get support from them. What the instructions, what task that is given to the child, and you involve the child, encourage the child to do, and any task that is assigned to the child, help the child to whenever the child needed, help the child. So parents role is to keep with what your child is learning, and you can support. So stay contact with the child. So, and the activities that are meaningful to child. And also, I like to say, parents as the role, you are not, no, you are constantly supporting the child from the beginning years. You are making them to learn how to eat, ride, cycle or something. Everything you taught them. So this is not going to be a task for you. So you can make them to learn. And don't take it also like you don't take it like you need to renovate your school in the home. No, not like that. No, not required for that. So you can help the child do the activities. You can't be a teacher. You can't be, you don't try to become a teacher, and it will not be no workout with the children. So can't try to be a teacher for the child. Support the child, create opportunities for the child. So with that, I'm thanking the opportunity given by our director, Nachiketa Raut, appreciating director of NIPMED, and our HOD, Department of Special Education, Sri Pri Kamraj sir, for giving me this opportunity. This is my number, and I have my references here. Thank you once again. So I think my presentation is done, ma'am. Gauri ma'am, are you here? Gauri ma'am,
Yes, ma'am. I'm here, ma'am.
participants, please mute your microphone. Please mute your, yes. Gauri ma'am?
Yes, ma'am. We can start the presentation. I'm trying to start the share screen.
Okay, okay, ma'am. Fine, ma'am. So, Madam Sri Gauri Rajesh, Madam is clinical psychologist consultant working in NIPMED. So, invited to talk on behavior issues and strategies and help the child, help the parents during this lockdown.
Okay. Okay, and also I just want to make sure my screen is visible.
One second, ma'am.
Thank you. And
Yes, ma'am. You are, yeah, ma'am. We are. Yes, ma'am. It is visible,
my
ma'am.
screen is visible. Okay.
Yes, ma'am. Yes, ma'am.
All right.
Please go ahead, ma'am.
Yeah. Thank you so much, ma'am. Yeah, thank you so much, ma'am, for that. And participants, extremely sorry for the technical glitch previously I had. So now to start off with the presentation on the behaviors and tactics. This is again the topic. Well, which is in pandemic time, during the pandemic time. I just like to talk a few. I just overview what I'll be talking for next of my presentation. So I'll be just briefing you on what introduction the daily schedules or activity schedules and importance of it and how to structure it. And at times, what challenges you face when you're implementing these schedules, and accordingly, what strategies you're going to follow. And in the end, I'll be talking about the suggestions for parents, because who are these? These are the people who are actually going to implement it. So there are few. This is the overview of my presentation. For last 4 months, I've been engaged in receiving calls from parents with children with special needs, and the main concerns are he's not sleeping properly, he's not reading, he's not doing his academic work, or he's not doing his writing like he or she used to previously. and sometimes they also pick up quarrels with the sister or the other siblings, and they also have seen the repetitive. There is an increase in the repetitive behavior and other behaviors like screaming, crying, hitting, so on, so much. So these are some of the scenarios which had just presented, and what I have been working for last 4 months. I'm sure this topic is something which we already worked in the clinical sector, but now working and implementing these schedules is really challenging thing for all of us, for all professionals. So the very nature of these problems will will impact that there is disruption of the routine. What they used to do before, and now there's a lot of the routine has been changed. So there are certain difficulties which children with disabilities or special needs are experiencing in to adapting to these changes. And in general, what I was, if you ask me what is daily schedule, daily schedule is technically in behavior management. It is what we call it as active or schedule of activities. It is the first level of management in what we do in behavior management. This is the first technique which we use in behavior management techniques. And it has been, based on my experience, I could say it has been extensively used. I mean, this is something which is my, this area which I have worked extensively and I've been implemented. And I've seen some better, outcomes with just with one active scheduling, or for you, it may be. So it has been exclusively implemented for all the ages with special needs across the disabilities and also various severity levels. Okay. Going to what is daily schedule, it's all been. What the daily schedule means, like all the speakers before me have spoken well in detail about the daily. Now the audio is clear. Okay. Yeah. So what daily schedule means, it has been discussed earlier by all the previous speakers, and it has been shared in detail. So I'm just running through quickly about what exactly the daily schedules and the importance of daily schedule in children with special needs, and with reference to this pandemic time. So of course, the daily schedules gives you a structure and it's more predictable. If everything is very clear cut, like what comes first, next, and what comes later. So these are very clear information which has been given in the daily schedule. And it also helps in transition from one activity to other. The child knows, especially children with autism, do have difficulties in moving on from one activity to another activity. So therein it reduces that distress in them, in helping them in moving on smoothly from the transition time, which takes from going on to one activity to another. And it also have a better control of the environment. Like you don't have to, it won't create any chaos and confusion. So you will have a better control, be it the therapist, or be it therapist at the center, be it as educator at the school, or be it a parent at home. So it provides better opportunities for us to have things at home. And it also means a greater participation, meaningful engagement in task. So this is what exactly a schedule should comprise of. And when you look at all these things, it also further decreases in behavioral issues and prevents the comorbid psychiatric conditions. So it has been researched quite a lot on this area, and has been found that lack of engagement in children with disabilities can lead to increase in behavior problem and also the psychiatric conditions. So the very nature of the daily schedule actually prevents the behavioral issues and other further psychiatric issues which may come because of the lack of these people are not being engaged properly and appropriately in various situations. So the importance in relevance to the pandemic, or with reference to the pandemic, is it has imposed a lot of restrictions on the children with disabilities, because earlier what they used to have, those activities have been cut short, and now they're confined to home. not going to therapy, not going to school, not accessing any other extracurricular or social activities. So this has imposed a lot of extra imposed restrictions on them, which is further leading to a lot of distress in the child, and which further it get manifested into various behavior problems. And then the lack of variety in the activities. So often you see the same stimulation, the same materials. So often the children would also get bored with the same people. So they might even, there are tendencies that even they get bored with these things and leading to the frustration. Now, how do you structure a schedule? This has been tried during my clinical time with a lot of children with disabilities, and what have understood, like the schedule should include all the areas, right from his activities of daily living, household chores, physical activities, play, academics, sleep, leisure and hygiene and safety also. So what I'm trying to say here is, so it should cover the entire area, so the domains for the overall development of the child with special needs. So when I talk about self-help skills or the daily activities, so I think this is the best time for them to teach the daily living activities, like taking care of their own needs, like taking bath or eating by themselves. So because earlier the mother, because of the time constraints, they would have fed the child or they would have got him ready, but now considering the time they haven't, they can utilize this time in investing, teaching that child with picking up these skills. And if you look at the household chores, give them the responsibility in including the child in the household. It should be given. It's not the child cannot do it, but according to the age or the ability of the child, you decide a task and assign the task to the child. Okay, that creates this kind of a sense of responsibility for these kids, and also a kind of an engagement also. Physical activities, yes, it's a must, apart from enhancing the gross motor skills, but it also adds to the well-being, overall physical and mood well-being of the child. Play is another main area which enhances the cognitive, social, language, and emotional skills. Nowadays, many parents had felt that how they have to keep the children engaged, especially the siblings. So this is where I felt there is a need for the cooperative play. Okay, the siblings together in a small group activity, because many children with autism will not like to play in a large group, and they don't like to involve in with other children. Okay, and anyway, in this pandemic time, they wouldn't have the opportunity to even to interact with others. So maybe this is a time we can utilize in enhancing this play, be it individual or be it in a cooperative, in a simple group play. And also, some kind of an interactive play, not necessarily just between the siblings and the child, but it can also be like with the parents. The parents can also involve themselves and, can be very engage them into the interactive way. The next part, your schedule should also focus on the academics. What I mean by academics here is the functional reading writing skills. Many parents have come with the complaints that my child is not writing. He's lost all that he forgot. He's not showing interest. Earlier he used to do homework, but now he's not showing interest. So these are the main complaints what the child, what the parents have felt. Okay, so in that scenario, engage the child in an activities wherein they get to involve in simple reading writing skills. Say for example, maybe a little older child can engage when he has a better reading writing skills, so can be engaged in preparing a shopping list, seeing the stock, how much he has to how many items has to be purchased, so right, like even the taking down the phone numbers and taking down the appointment of any consultation or tele-counseling sessions with the therapist or something like that, writing down. So this is what we can do it while focusing on the writing skill. And also build across the curriculum. Special educator myself, I also felt that there is need right now to use one topic to teach. For example, considering the resources which we need. So when the child comes to the center, we are there to, there is a max class, special education, I mean, there is a class, there is extracurricular class. So every class has been, okay, every class has been in that manner. But now the entire responsibility has share of mother, the mother will not have so much time considering the other responsibilities of us. So let us have something like a topic which has been dealt and which can be taught, which can be included the reading, writing, even that can be included in the math, and in for some children with high functioning kids, it can even be a science and social activity also. So one topic which take care of the different subjects. The other thing, and this is the most complained and the most important aspect, which even Madam Vijay Madam also spoken about previously. So it is the need, because right now many children are losing on this. So your routine should also include the sleep, establishing a sleep, which I'll be talking in detail little on this part, and leisure activities. Or you should have the downtime activity. It's not being occupied and always be watchful of what they're doing, but let them do. There should be allocated time they can to do. So it even engaging in a repetitive behavior or some kind. So some of the behavioral issues which can ignore at that age, and thinking that the child can engage in those activities because that is need or for him kind of downtime activities. The last one I would emphasize, and which I always, to a certain extent, have taken a backseat in our, especially when we are planning the planning for hygiene and safety. So hygiene, yes, it is the most needed skill to be taught to the child. Hand taking so hygiene, behaviors have child has to be these behaviors have can be included in your team. And that's safety. This is avoiding any kind of the physical and the other kind of an to deliver, to make sure the child take these activities or the skills includes. And
Hello.
Sorry for the network issues. Oh, we'll yeah, we will make it done in a minute. Please stay on line. Check where Gauri ma'am is.
So can I start, Revati madam?
Yes, ma'am. Yes, ma'am. Please, ma'am. Sorry for that network issues. Please carry on,
Yeah.
ma'am.
So can someone tell me like where the exactly the which slide I've got disconnected so I can go back to the slide and discuss. Hello.
Ma'am, you can start with this slide, ma'am. Sleep hygiene. Yes, ma'am. Ma'am, or
Okay,
you
fine.
can start from the
Yes,
beginning
yes.
also. Or, yeah, two, three
Okay.
slides.
Okay, ma'am. Yeah.
Yes, ma'am.
Okay, one second. Let me go back. Yeah. I think this is the yeah, I'll start from here. Okay, so I was talking about what all the domains we need to consider when you are planning for the scheduling the activities. Okay, so all these domains are very important part of a child's life. So nothing can be ignored or overlooked. So all these have to be given equal importance when you are considering it. For example, like activities of daily living, like it's the best time for anybody to teach. Okay, so because many parents are in dilemma, like what exactly what I should be teaching. So many parents have come up to me and asking like, how should I make the child, keep engaged, or what activities should I teach and all that. So definitely I would say personally, so if the child is still yet to pick up some self-help skills, so start investing on those teaching him on the activities of daily living. There was a child whom we had recently interacted. The parent told me like the moment as when he was in the when he's at home, he doesn't even use the restroom. So all that he just spoils his pants. But when it has been checked with the special educator, but she said no, in school it is very he goes on time, and he always keeps dry. So what exactly is happening, that there's a break in the routine, disruption in the routine has brought some kind of a changes. The child is not able to go on because he at home there is a lack of routine, so child is not in the kind of in a same routine like how we used to be in the school. So exactly there will be a break in the school, so at that time the child is being led to use the restroom. So whereas it is not happening in the home, so this is how the incidences are taking place. So this is where the importance of setting up a time for everything comes in place. Of course, the household chores is an again important thing. It can be assigned based on the age and the ability. It not only creates a sense of responsibility, but also adds on a lot of skills in the child, like for example how to organize, how to plan. So all these skills, especially certain skills in these are the skill deficits in children with autism, can be enhanced through these activities. We have been working with one of the child with autism who was very much interested in household activities rather than the reading writing things. So what me and the mother, this was what I'm talking, this is before the pre-lockdown thing. So what the mother said, no, he is not showing much interest. And I said, what he exactly he likes. So he said, no, he likes to do this, he likes to do that. work, that work, and he does it very perfectly, and he shows great interest in that. So what we have decided, let us now start teaching him lot of these household responsibility, like how to fold the clothes, how to cut the vegetables. So all these are nothing but there are certain skills, even when we talk about the new executive functions, organizing skills and planning skills, all are nothing but your executive functions in the children with the autism. So this will take care of those things. So and now the child is happily doing it. And of course, recently when the mother called me up, see, she has shared the photo saying that, see, this boy has been now engaged in doing, and so perfectly was folding the clothes. Okay, it was, I think even none of us would be master that skill. So perfectly he was, folding that cloth. So I think, so you have to rely on the interest of the child also, and utilize that interest for your keeping him engaged, or teaching him further skills. Physical activities, yes, of course, it's a must, and it not only focus on the gross motor skills, but also it is more it is overall contributes the well-being of the person, both physically and mentally. If you say what physically, because children with disabilities also are prone to other medical conditions, be it obesity and other, like what we, as we age in, we do develop certain health conditions. Even they do have their more prone to it. So it is better to keep them engaged, not to spend too much on sedentary life. Play, very important, because focuses on cognitive, social, language, emotional skills. And many parents have started feeling that now this child is not being engaged. Most of the children with autism and other children with multiple disabilities, it's very difficult for them to engage with the other kids. So what we have done during the pandemic, why can't we include other kids? Okay, there are many parents started using things, and started including siblings in the play activities and develop the cooperative play. So the play can be small group activities. The child also be comfortable, at the same time he is engaged. Academics, as was talking about, it's a focus should be the functional reading writing skills. Yes, exactly, because whatever he had learned now in the school, now let apply it in your own environment. See how whether he can even make a list of whether he can make a shopping list, whether he can write a date on the blackboard, or whether he can write his favorite TV shows, or timings of the TV show. All these things, whatever has been learned can be utilized at this time. So thereby, all these things have been retained. So nowhere you feel like the child has been, forgotten, or he has lost the skills. So all these skills are getting retained. And the other thing which I always use this thing is teaching across curriculum. Teaching across curriculum is something which we have learned during special education training, where you focus on one particular topic, and you try to teach the various other domains, like for example reading, writing, okay, and for maths. So one topic is being taught in a different domains. So this can be also considered, because considering demands on the parent right now, it is not it will be very challenging for the parent. So it will be very challenging for the parent to engage this particular child for different other activities. I think this is the best time to to also maintain any education program for the child and home-based program for the child. It's always important for us to plan in a manner where we can deliver, and we can make the person feel that she can be able to deliver it at home. So that is something which has to be focused on. And the sleep routines is must, as most of the speakers have spoken about. It is a very important part, because sleep, if it is proper, child will develop. He will be having difficulty, the concentration, not to cooperate, other behavioral issues now develop. So I think that important. So when you're planning for the day schedule, make sure that we will be having it also. I'm talking a little more inputs on that. Leisure skill activities is again giving the time for their own time. Leaving the child for some time on their own. So all these time you have been totally trying to keep him engaged, at least if not 100%, at least 80%. You should try to do it. When you're doing it, I mean, you are just letting the child to do what he wants to do. Okay, he can be wherein he can engage things. Me time activities. And last but not the least is the hygiene and the safety. Yes, pandemic period, corona period. So we have to now focus our importance on skilled, healthy, focus on the skills on gaining the healthy behavior, healthy behaviors also, like maintaining a social distance, hand washing. All these are little challenges because when you see some children with sensory needs do have this have a habit of putting. So I think in there, this is where again we have to gradually train on those aspects. And safety, of course, is the most relevant thing. Safety, protection from other things also need to be included when you're trying to include talk about things. And what I this
Gauri ma'am, audio is not, couldn't able to hear you, ma'am.
all he will be little chiller. The father will be working in that room. The noise or the light from that room can also trigger sleeplessness in the child. So the environment, including the mattress where you're sleeping and the pillow, and all things makes a lot of difference when it comes to your environmental aspects. Scheduling, again, the sleep, what Vijayalakshmi madam has spoke about, is having a proper, a regular sleep awake schedule is important to, to get a very effective sleep. I know it is challenging for many children, for our children, but again, this really helps a lot when you try to have a proper sleep, because since we don't have a school and other things, so it should not be that you're sleeping late at night and waking up a little late in the morning. So let us have the same timings for all the days. Sleep practices is also an important part, which helps them to fall into sleep, like bedtime routine. Some of them, like to listen to stories, and some of them like to, hold one, want their parent to be next to them, and some of them even like to listen to small music. So all these things will, help them to fall into sleep. One thing we need to also be take care of, it should not be too exciting for the child. I mean, make sure that it should not be too telling a story which makes them more excited, then they'll be more awakened. So make sure that these things will not, if some certain subtle things like subtle activities, so that they can fall into sleep. Physiologic activities like physical, taking care of your physical needs, meantime, like what madam also said in the morning, which like sometimes most of the children fall asleep without having proper food. So these things need to be also be taken care of. Then the exercise, the physical activities, all will constitute your sleep hygiene. So these are the areas which we have to look into further. Similarly, I just want to highlight on physical activities also. This has been suggested by the physical activity guidelines for Americans. So, but we can use it to our kids also to see how much we can implement this. When you see it, at least what has been recommended is one hour to moderate of rigorous physical activities. Every child, a child till adolescent should get involved into it. So they say like it should be like a lot of aerobic activities or muscle strengthening activities, bone strengthening activities. Aerobic activities like anything like running, hopping, skipping, whatever the child, cycling by, and all these swimming. Now the swimming is not there, but still whatever which within you can do it in your own physical space. Muscle strengthening activities like tug or climbing trees. Of course, these are a little difficult, but at the same time, safety is also concerned. Lifting weights. So all these things can be, improving in a way, improves your muscle strengthens your muscle. Bone strengthening activities. So again, the same running, jumping, kind of involving in sports. So all these are nothing but your bone strengthening activities. So these are a general view about how you can engage or engage when involved into the physical activities for the child. Yeah. So now the challenges. I know we have been it's very easy to listen to what we have been talking, like very easy to sounds very good when you're listening, but actually when it comes to implementation, it is really a great task. So you may find sometimes the child will have difficulties in complying to those schedule. They may have behavioral issues. They may be focusing on a very particular activities. Sometimes some parents also get worried that they'll get fixated to the routines. So I think a great need and care has to be taken care when you are actually developing a certain these daily schedules, because these have to be, it cannot be one time task. It has to be reviewed, seeing at least what I normally say, at least you try and see for next 1 week or 10 days, see whether it's working or not. So once they come back to me, then I can change it according to the difficulties what the parents had felt. So these are the things. So you have to see the feasibility of implementing that part also. And also, it's not just the child part, but also the caregiver part. So see whether the caregiver or mostly here the mother or the primary caregiver or the father, so whoever is taking the responsibility of that part, they may be actually having the other responsibilities also. See whether it is possible for them to involve or implement this kind of a structure to in the home, and if it is not, then who else can be done at that particular time. So we have to plan it in consultation with the parents. And environment again is very important, considering your own physical space limitations because sometimes we say what Madam Ansuya Madam was talking in the morning, like also consider the environment of the house. Okay, it is sometimes you may suggest some activities which may not be easy for the person to get involved and to get doing this. The people may be living in a very small place, so this may not be possible. So even the ecological the environmental aspect is also important for them to implement this. I think family members' role. See whether the extended family member have been getting involved, or whether there are any sharing of responsibility. And the most important part is the expressed emotion. So expressed emotion, something like the caregiver. It could be the intensity of your expressing your concern towards a person. It can be a very positive, or it can be sometimes negative. Positive, it's well and good, but when it comes to negative, like blaming him, scolding him, criticizing him, so all these can lead, have some impact, psychological impact on the child. So just make sure that this can be avoided, and whether these things have been involved at the family. Other clues, others can be like clue dependence. Each time if the mother is sitting there, only he will be writing. So maybe these are some kind of other challenges with what the parent also has suggested, and a medication is also another. Sometimes they feel drowsy. You see children with who are at anti-epileptic drugs, they feel very drowsy. So you have a structure, but the moment you go with that task, and the child will be drowsy. So you have to consider these aspects also when you're planning the schedule. Okay. Some of the strategies, since we have spoken about the behavioral issues, we have to understand why this particular behavior is happening. So the very beginning of the behavior management starts with your understanding of your behavior problems. So what we do for that, we do ABC, which is nothing but your antecedent behavior and consequence. So when you see, most of your daily schedules are actually a kind of your antecedent management technique. So apart from that, and you also need to collect the data on how frequently the behavior is happening, and when it is happening, the duration and the intensity of the problem behavior which is happening. And based on these information only, you have to go in for your detailed behavior management. So most of us are aware. I think this is just a glimpse of, I think many of you are aware, most of you are special educators here. So we have had talked about this learned during our training period. So if you see antecedent behavior and consequence things, so you have to note it down under risk circumstances and context the behaviors are happening, and how many times it is happening, and how do the people react to this behavior. So this is how it has to be recorded. Understanding based on your ABC only, you will be coming up, across the identifying the functions. In general, again, it is a known thing. It is, again, you have 4 functions. One is your attention, escape, and tangible. So attention is when the child is engaging in a behavior to engaging in undesirable behavior or problem behavior to get your attention. Okay. Escape is when the task is engaging in undesirable behavior when the task is given to him or any work is given to him. Tangible is engaging in any behavior wherein he needs that when certain demands of him is not met or it is not being yielded. These are called tangible. And self-stimulatory, of course, this is kind of a repetitive behavior, so which uh, most of the when the child is being not engaged, and there's no reason for that. Sometimes when the child is not engaged, also this kind these behaviors happen. So accordingly, we come up with the management part. So I'm just going through quickly on the management part. If you look at the management of the attention-seeking behavior, um, once you identify that this behavior is mainly because of the attention, so that the child is seeking, trying to get the attention. So try to engage the child. First of all, you have to replace that behavior in a very appropriate manner. Okay, with a very appropriate behavior. Okay, try to encourage, because sometimes if the child wants an attention, he just comes and hits you. So that is sometimes is unexpected for many of the parents, and it is so hard and so painful for them. So I said, okay, you just try, just be alert, and also try to communicate to the child that he has to be called by non-verbally or verbally, or use the words. So some way it has to be done in a very appropriate manner. Provide attention for only appropriate behavior. So what happens when you're providing attention to only the appropriate behavior? The other behaviors, which is undesirable behaviors, are ignored, and only the behaviors which is desirable is getting attention. And in a way, for a child with attention-seeking behavior, that in itself is a reward for the child. Ignore the behaviors if possible. If it is not self-injurious behavior, if it is not harming anybody, please ignore the behavior for some time and see whether this child calms down. And during that time, and especially when it is a self-injurious behavior and the attention is the function, you cannot ignore, you cannot use the technique of ignore, but you have to block the child for preventing him getting injured, and if possible redirect him to the other activities. And during that time, there should not be any eye contact, no conversation, no lecturing, and no offering any kind of a rewards. All these things are strict no when you're following the extinction technique or ignoring technique. Yeah, looking at the escape task. So most of the children don't like to, the task they like to avoid. So in children with disabilities, also with autism and multiple disabilities also, many of the task activities are very challenging for them. Be it with a social interaction, or be it some kind of a reading writing task, and be it any self-help activities. So some children would definitely, when the task is being presented, they may be having underlying, deficits for that. It could be because of lack of communication skills, or it could be because of a lack of deficits in the motor planning. So all these things can, have an impact on refusing the task which has been presented. So break up the task. So first thing, if you have a huge thing, I know it is not a huge, but if possible, try to break up into a smaller thing. Like for example, if you have a writing task, so give it in a smaller, like let him write it for 2 lines, and then a reward be given to him, and then later on he can come back and write the 2. So the entire say for example 5 to 6 things can be can be broken into the smaller parts. Use the child preferred activities, and initiate the activity when with a simple task, and then gradually proceed. The very thing, if you start with a complex task, definitely you not get the compliance. So better tasks with the simple things with the child can accomplish, learn to accomplish, and also get rewards also. Use a very clear and explicit instructions. What is required for the task? Okay, that is very important when you're working with this student, and immediately you need to reinforce the child for that task. Yeah. Whether moving on to the next function, the management of the next function is a tangible. So provide, because if the child wants certain things, even sometimes certain times now it's a lockdown and you cannot go out all the time. So you should have a time for eating. Like most of the time, child would like to have to play with the mobile, or the child will like to, eat something which is not available at home. So there should be a time set for all these things. Okay, there's a time for TV. So all these things should be planned, and that is where your activity scheduling or the daily scheduling comes in handy. Be consistent in using the technique. Okay, if you're going to have your biscuits or your TV time only at this particular around 11 o'clock, so every day it should only happen at around 11 o'clock. Ignore the child if he's doing tantrums, and if he is behaving well, reward him for what he has been done and obeyed. So, self-stimulatory behavior. For self-stimulatory behavior, yes, the activity scheduling really works very well. Here, I would also like to suggest many of us, see, when you're including the self-stimulatory behavior, most of the behaviors are at times, are very calming for them. So don't try to, stop the behaviors. Try to see whether if you can reduce it by providing a activity scheduling. And if possible, if you think it is getting a little more, if you can teach an alternate and appropriate behavior, that's well and good. So I have seen one child who was having a habit of humming when she's writing. So the mother had requested, like, how can we reduce this? So what we have suggested, like, can we, when she's writing it, can she spell out the names or the letters? So this had been further reduced that, because she's trying to get that auditory seeking stimulation. So that can be even be done through a more appropriate behaviors. Okay? And in between, you need to also provide them the sensory breaks. Yeah, the other behavior strategies, as I always already mentioned, you provide a simple instructions, engaging them in a household things, and reward consistently. Your communication style is also an important part. Independent task is again, because this reduces the assistance and the prompt from others, and also can he doesn't have to people don't have to supervise him all the time. And if possible, state the rules, what clearly what is expected. And I always think, when it comes to teaching the new skills, or always go with the errorless teaching. Apart from using all this thing, there's an assessment of the physical environment and the family routines and the materials used also is important when you're considering from the home-based plan. Yeah, these are the task variables. You have to see whether what is the what task you have selected, how you are presenting the task, the materials, the task complexity. These are all being discussed before, but I'm just trying to help you out in that. And task completion, the clear start and finish. So this is a glimpse of how you can provide a task. So here the child has to draw 4 lines. Here he has to just match with the picture. He has to just assemble the blocks, or place it into the pegboards, and there are only 5 to 10 pegs to be assembled in the pegboard. Yeah. So in the end, I would like to say that it is since we are focusing on the the home-based part, we cannot ignore the parents. So the mental hygiene or the well-being of the parents is also important. So always include, when you're considering any plan or intervention, always include their needs also. Let them get the a proper sleep hygiene, and also their need for them. They should also have time for themselves. So self-care is a very important part. Take up a small goals and work with them. So let us not. Many parents are very anxious what all I have to do. So you just help them to set up a small goals where it can be achieved. And training in the competency skills of the parents is also better, because ultimately they are the one who will be working out at home. And apart from that, other relaxation techniques if possible, and encourage them to seek support. So with this, I'll end my conclusion, and I'll convey my thanks to my department, and also to the Department of Special Education for giving me this opportunity to present. Thank you. So I look forward for your questions and queries.
Thank you, Gauri ma'am. It was very nice presentation. very much detailed about the schedule and sleep all the topics that now I invite staff to our the next speaker.
Okay, now we are going to the next. I invite to the next speaker for in this webinar, Srimati P. Lilavati. He is served as a lecturer, serving as a lecturer in the Department of Special Education. She is a principal of NIPMED Model School. Highlight about our resource person. She is the first graduate in multiple disability, National Institute for Empowerment of Person with Multiple Disability in Chennai. He specialized in the field of special education, HI and DB, and multiple disability. He served more than 20 years experience in the field of rehabilitation in the area of cerebral palsy, hearing impaired, intellectual disability, autism, and multiple disabilities. She completed the MED intellectual disability, MED multiple disability, and so completed in diploma in vocational training programs. Has authored chapters, units in study material for RCA manuals and some university chapters. Acted as a sector of question papers and evaluator for RCA recognized courses in national level. Member in the team of inspection organizing the registered under the RCA offering the courses in India. Coordinator and resource person for different CRE program under RCA organized by various organizations and some universities in the state and national. Ma'am published articles in the reputed journals and presented many national and international paper presentations in her area specializations. She has acted as a chairperson member in various committee in the institution level. She is handling in the project for resilience project for the children with special needs, families and siblings. She served as a HOU for HRD Department of Special Education. He is sharing the resource persons materials for multiple disabilities. He is sharing the research knowledge for our MED scholar to feel completed the MED programs. Now I hand over the session to the Mrs. Lilavati Madam to enhancing the life skill during the COVID pandemic period for children with autism spectrum disorder and multiple disabilities. Welcome ma'am and share your knowledge for this occasion for the webinar participants.
ரெண்டே கொஸ்டின் தான் இருக்கு. ஒண்ணு வந்து ஃபோன் பண்ணிடலாம் அவங்களுக்கு. மூணே கொஸ்டின் தான் இருக்கு. ஒண்ணு வந்து சொல்லுங்க நான் எழுதிடுறேன்.
Good afternoon. Last speaker will be a very difficult task. So my topic is life skills from morning onwards, you having hearing about daily schedule, then sleeping pattern, and behavior management. And academics also you discussed. So the last one is life skills. For to teach these skills for children, no need to spend any extra time. It is an integral part of the education program. So as parents can continue with their work, little bit patient and little bit explanation each activity can go ahead with this. Okay, so life skills will help us to promote well-being and beauty. Life is precious for all of us. This need to be filled with joy and lead with hope. For this, we need to enhance our life skills and go ahead in life. So, COVID-19 has totally changed our life, especially for parents. The parent role has changed from facilitator to disciplinary member. Where she became a child manager, she has to take the input from the multidisciplinary team, need to implement for the child, and monitoring also in her hands. Another thing, understand the child globally. So the parent may be certain time she used to spend and give the feedback.
Ma'am, your screen is not shared, ma'am. Uh, so just in couple of minutes, I think Madam will join for the presentation. Ma'am, we are seeing you, ma'am.
I'm audible, ma'am?
Yes, ma'am. Yes, ma'am.
I'm audible? One second.
But screen is not shared, ma'am. Shall I share the screen, ma'am, from here?
Yeah, I'm clear. Now it is okay, ma'am? Screen sharing?
Just a minute, ma'am.
Yes, ma'am. Yes, we are sharing, ma'am. I'm audible, ma'am?
Okay, ma'am.
Ah,
yes, audible, but screen is not shared.
Okay, ma'am.
Share the screen, ma'am.
Madam, give me.
Kindly pin NIPMAT specification.
Ma'am, audible? Go. Sharing? Share it? Screen sharing is there? No. Revati, ma'am?
Yes, ma'am.
Screen is coming?
Yes, ma'am. Ma'am, continue, ma'am. Meanwhile, I'll find.
Yes, ma'am. Yes, ma'am. If I am audible, I will continue with my presentation, ma'am. No issue.
Yes, ma'am. Now.
Yeah. Okay. So we will go ahead with the presentation. Sorry for the inconvenience. So we will start up with the life skills. So little bit we will analyze about the life skills. Life means any system capable of performing functions such as eating, breathing, moving, growing, and responding to the external stimuli. Skills are abilities acquired through practice and patience. How we have to complete it, that is how we are going to complete the task, our ability to complete the task. So any skill that is useful in our life can be considered as a life skill. So comprehensively, if I say, life skills are a group of psychosocial competencies and interpersonal skills that help the people to make informed decisions, communicate effectively, and develop coping skills and self-management skills to lead a healthy and productive life. So if you elaborate the definition, life skills are abilities for adaptive and positive behavior that enable individuals to deal effectively with the demands and challenges of everyday life. So adaptive means to have a flexibility to adjust according to the situation. Positive behavior need to have positive thinking and look at opportunities even in difficult situation in order to cope with the situations. So during this pandemic period, every one of us have to focus on enhancing our life skills to win this battle with COVID-19. Adjusting for new lifestyle, positive thinking, establishing relationships, coping with technology, willpower, strong determination to fight with this virus, hope on bright days to come as soon as. So why we need to have these life skills? The first one is to develop a dynamic self-image and great self-esteem, to make a relationships and handling interpersonal problems in better way, to deal with the challenges of everyday life effectively, to reduce vulnerability and improve utilization of protective factors, to enable the youth to adapt to the situations and people, to translate knowledge, attitude, and values into actual abilities by helping us to decide what to do, when to do, and how to do it. So enable adolescent boys and girls to utilize their skills such as functional, occasional, livelihood, and literacy skills better. So finally, the life skills will help us as an instrument for empowerment. So by these skills are this is more important for youth with multiple disabilities, because if you take youth with multiple disabilities in two categories, I am not going with the prominent disability, I am going with the functionality. So for high functioning children to deal with the demand of life, to compete with the modern world, successful social interactions, best community presentation. For this, they need life skills. Same way, for low functioning children, increase level of independence, opportunity to explore the world, global use of his capacities. For this, life skills help the parents feel worthy of their efforts. When they see the changes, when the child is doing some activity or taking decisions, they feel worth and reduce the burden. Even 24 hours are teachers. So sometimes when they take decisions, burden will be reduced. Feel confident to move forward. For teachers, anyway, they are going social curriculum, low functioning children. In that also, they can enhance and so they can more focus on use the content and focus on so life skills, according to WHO, we broadly classify into social and interpersonal skills, cognitive skills, emotional and coping skills. So these all life skills we are discussing for whom? The children with special needs or multiple disabilities, whatever is. By whom? The mainly teachers and parents. Where? School, home and community. And how? Integrating educational program as well as developing areas including life skills. So when you enter the pond only, you know the depth of it. Same way, you need to understand the life skills to develop these skills in among children with multiple disabilities. So the first skill is social and interpersonal skills, which having self-awareness, communication skills, negotiation, assertiveness, interpersonal skills, and empathy. So the best gift we can give for children with special needs is giving social awareness. Help them to know
Yes, there is connection issue again. I think so. Participants can mute your microphone. Participants can mute your microphone, webcam, so that we can save the bandwidth. That's the issue here is like participants all are, many of them are, your webcam is on. Please mute your webcam. Pin on presentation, yes, sir, Geeta is presenting, where madam is, the speaker, Leelavati madam is speaking over. Yes. Ma'am,
Okay, audible?
yes, ma'am. Now
So
we are hearing you, ma'am.
Yeah, ma'am. Please, in between, you tell, ma'am, either I'm audible or not. Right? Sorry for the participation. Yeah, please. Okay, I'm going ahead. So, for parents to feel worthy for their efforts, reduce burden, feel confident to move forward. For teachers to enhance the quality of content, focus on real life experiences. So totally, the life skills are classified into social and interpersonal skills, cognitive skills, emotional and coping skills. So these are all skills today we are mainly focusing for whom? For children with special needs, by whom? Mainly teachers and parents, where school, home and community. So how we are going to integrating this in the either in the educational program as well as in the family support plan. Both we have to integrate this. So when you enter the pond only, you can know the depth of it. Same way, need to understand the life skills to develop among children with multiple disabilities. So the first one is social interpersonal skills. Here include self-awareness, communication skills, negotiation, assertiveness, interpersonal skills, and empathy. The first and most important skill is self-esteem. The best gift we can give for children with special needs is self-awareness. Generally, based on their ability, we may generally reduce the content, but here we should not reduce the content. We should give how much information we need to give. And this is the child right. So when you perceive the child as a child, then you can give. So never ever think he is disabled, he is having some issues, so we need to reduce. All those things will come under the functional academics, all those things. But here we need to give complete information. Revati ma'am, am I audible?
Yes, ma'am.
Thank you. The first one, help them to know. Okay. Help them to know and understand themselves first. their potential, their feelings and emotions, their position in life and in the society, and their strengths and weaknesses. A clear sense of their own identity, where they come from, and the culture in which they have been born and which has shaped them. Okay, so knowing with this, being aware of strength boosts the self-confidence and self-esteem. Knowing about weaknesses will motivate to learn. So with this, self-confidence will be boosted and self-esteem will be developed. Self-esteem is how we think about ourselves, how we feel worthwhile about. So this right has to be given for special children also. The second important skill is communication. Communication skill basically focus on receptive and expressive language. The another thing which we need to focus skills is communication. Types of communication include communication, aggressive communication, confident communication. You give a different types of communication, change try to express using those patterns. Where we understand. So, when we are able to communicate, he can able to clearly present his wants and needs. When he has issues, he can use aggressive communication. And he don't so give options to the child. We are giving
கேட்கல ஒண்ணுமே திருப்பி மியூட் அமுக்கிட்டாங்கன்னு நினைக்கிறேன். மறந்துரும். அது எப்படி அங்க கை கரெக்டாங்குது? மேம் திருப்பி மேம் பிரசன்டேஷன் திருப்பி அமுத்தி விட்டுட்டாங்க மேம் அவங்க.
Yes. Revati ma'am, audible. Shall I continue?
Yes, ma'am. Yes, ma'am.
Very good. That is playing with us. We also going to play. Okay. Fine. So social interpersonal skills, the third skill. Till now we discussed awareness, self-awareness, and communication skills. The third one, social skills. So here we will focus on negotiation skills, saying no, assertive skills, which I most like. So negotiation is the ability to compromise on issues without compromising one's principles. And will give self-awareness to the children, then only this will be used. The assertiveness skills. This we need for special children. Generally, we dominate. We means the parents, teacher. We all will dominate the child, and we will have a schedule. We will ask child to go with the schedule and all those things. But assertive skills, how you will teach? When you add flexibility to his schedule. So generally, we will say in a schedules it should be structured where we will give the challenge choices. There, this is the one component. Flexibility need to be added to that so that the assertiveness will come. So when he will select, no, I will do this task. So like that, the child will start learning assertiveness. Slowly, this can be spreaded to other skills also. How much time you need to study, how much time you need to TV, all those things. Generally, another thing which I want to share it here, visual schedule we will make for the child and we will put it either at home or in the school we will share for other children also. But at home, only the child will have a schedule, not others. So this becomes like the child only having something. No, it should not be like that. In this time, we need to give other schedule also. Okay, mother is doing this time, this she is doing. Father is doing at least a minimum, not a detailed schedule, at least minimum which is coincident with the child activities. That schedule can be put up in the same place so that the child will understand the schedule is not only for me, it is there for all. Only I am following. That should not be coming the child. Then only the assertiveness will start. Then only we will compare. Okay, when I am doing this activity, my mother is doing this, my father is doing this, my brother is doing this. So like this, he is able to compare that. Right. So then only the assertive skills will start. So we need to give this opportunity to the child, not only developing a schedule for the child and displaying at the hall, for others also, parents, at least minimum schedule has to be displayed so that we will give a respect for the child. Then, then being able to take the necessary steps to achieve what you want to within the specific context, right? Need to be, in this we have to see two things. One is, we should not go in extreme ends, like one is passive and the second one is aggressive, where the child will be keeping knowingly, either knowingly or unknowingly keeping quiet and not standing up for his wants or his rights. The second is aggression, where the child just fight whatever he wants without any consideration of the context or the people with whom he is interacting. So these extremes should not go, but assertive skills need to be taught for the child. The third one, interpersonal skills. Relations will add life to our colors to our life. Without relations, we can't continue. Right. So this will come different shapes and sizes. Like we will have personal children, parents. It will go continuous. The world will expand like this. So children need to experience that. Need to provide opportunities to expand their world. Then with the family members, caregivers, then surroundings like that, it need to be expanded. Another skill which we need to teach for the child is empathy. The ability to sensitize another person's situation, to understand his concern, worries, fears and need, how they feel. These are the two skills we need to teach. For this, the mother is the best person to start up this skill. I am not saying the mother only going to teach. To start up these skills, the mother is the best person to teach this, according to my opinion. The objective is that he should understand at least the basic situations, basic interactions. When the mother feels tired, teach him that how he can support you, like giving you water, looking at you with a smiling face, or sitting with next to you, or supporting something like that. Supporting you in small household activities, then you give me a warm reward, so that the child learns learning the empathy and interpersonal skills. The mother and child need to build a new world where support each other. Not only the mother always supporting the child also can support the child in whatever way he can. Slowly this can be extended to other people also. So the third one is cognitive skills. Here we will have decision making skills, understanding the consequences of actions, determining the alternative solutions to the problem, critical thinking skills, analyzing peer and media influences, analyzing one's perception of social norms and beliefs, self-evaluation and self-clarification. So cognitive skills, here we are having critical thinking and creative thinking. So critical thinking means ability to accept change and newness. Creative Creative thinking, art of analyzing and evaluating thinking in which we have to improve it. Then decision making, to choose from the varied options based on the existing knowledge of topic under the consideration keeping in mind positive or negative consequences of the each of it. Then problem solving enable us to deal with the problems in our life in a constructive manner and identify the problems and finding the best solutions for this. So this is looking like a very difficult task, but when you start working with this, like I have given examples here, giving responsibility of ownership and some places. First one is the personal area. You are giving to the child, ask the child to maintain that particular area and show them how others are maintaining. Don't give it only for the child. Divide the room in for different people who are maybe siblings and ask them to maintain. So he is getting the role model as well as he is getting motivated to maintain that. Initial stage, you can help the child to maintain. Slowly, you can fed up your support. The second one, common area, wherever maybe hall, somewhere you have to give some another place where the child can be maintained. Third one, garden, where he will learn lot of skills. You can teach lot of skills. So these are the three areas you can start up to develop the critical thinking and decision making skills. So emotion and coping skills, here we will have managing stress, managing feelings like anger, skills for increasing internal management. So managing stress, managing feelings like including anger, increase the awareness about the surroundings. This is the first one which we have to do it. So when you know about the surroundings, your brain will be expands. Like you will understand, okay, here it is, there it is, it will goes like that. Then you tell the child present and future things which may influence the child. So these things may come in, these things may come in. Now this is the time we'll go with like this. Like this we need to explain to the child. Opportunities to express his feelings as well as observe others. Using teaching points from the family members and neighborhood and explain. So if somebody is shouting, why he is shouting? What is the reason for that? What are the consequences? Now we have that time, all are at home. So you can use those teaching points to teach the child, to explain to the child. This method will help the child positive or negative ways of expressing anger and also understanding the consequences. So he is understanding that, okay, somebody is having disturbance and how it is going up. After that, what is happening? This much the child will get. Actually, this is an abstract concept, but during this time, you can give this a concrete concept. Then last one, skill for increasing self-management. Generally, this one thing which I introduced for 2-3 children. Like we are giving the worksheet and we are telling the child to correct it. So that worksheet will be in child level. So he will see that. So when he is able to correct, he is understanding, he is learning more than when he is writing. So that one thing we need to introduce for the children. Then diary writing, which will help the child. He may be just putting pictures or whatever may be. We can help in initial stage. Later on, the child can continue with this. Memory boxes will help the child. So last year, wherever he went, what all the things he has done, that will help the child to build. And that these memory boxes and the diary writing can go together. Right? Then self-evaluation, the last one. So every week, the mother and the child can sit together. Anyway, they have evidence with them. They have the worksheets for academics. They have the evidence for daily routine. Daily writing is there. Then memory boxes is there for some important class. So you have 3 things with you. Now, both can sit together and evaluate and have a discussion on that. So some more techniques to enhance the life skills is generally in the class means class discussion. In the family, you can have a family discussion, role plays, small group work, games and simulations, situation analysis and case studies, debate and storytelling. So by whom we are expecting these life skills during pandemic periods? Obviously the parents. The parents, I want to say a few words about the parents here. Like first they came out to find the answers for basic questions about their children. What is their condition? What about their future? Like that the parents are come out. Till the time the education of the children is very slow. When the parents came out, they can move. So then their strongest drive and accomplishment have been in promote the legislations Their efforts have been rewarded by the repeated laws that support the rights of the child. Now another new task at your doorstep, which you need to take it up now. Focus on the life skills. Provide opportunities in different situations to learn as well as use the learned skills usefully. For teachers, there are three methods you can teach life skills. One is augmentation. So you can incorporate this as in your IEP and can continue the task. Otherwise, you can modify. In Fusion, you can modify according to the suits of the individual child. Then integration. This can be a topic is addressed by drawing together content related and from various academic areas, enabling the student to play academic skills across different life skills. These are the three areas you can teachers can use to teach life skills. So finally, so we need to understand the diversity of the child. We all, not only we, the parents, all, whoever is working with the child, need to understand the diversity of the child, accept the child, respect the child, accept the child, respect his abilities, provide space to grow and give wings to fly, support to achieve heights in life, fill his life at the same time, fill his life, fill his world with joy, make his way responsive. Wherever he needs support, he needs to get it. So he has to move. His way should be smooth with the supportive, with accessibility. These are the precious gifts we can give for special children. Thank you. Revati ma'am?
Yes, ma'am.
Yeah, ma'am. Thank you, ma'am. Thank you for the opportunity.
Okay, ma'am. Thank you, ma'am. Thank you so much, ma'am. Ma'am, in the chat box, one participant is asking one communication skill. That slide we couldn't able to see. So can we?
Yeah, I will present. Yes.
That,
Communication.
Communication skills.
Yeah, we'll share it.
Vasuki Devi, ma'am, please don't present, ma'am. You are presenting, so speaker is not able to present, ma'am.
They have to stop.
Stop presenting. Okay. Yes, ma'am. Yes, ma'am. We are seeing. Yes, ma'am.
You want any clarification in this, ma'am?
No, ma'am. Just wanted to see that, ma'am. Once you can explain, ma'am. That.
Yeah. Yes, ma'am. Yes, ma'am. In communication skills, generally we will focus on receptive language and expressive language. Based on the child ability, we will expand that. Maybe for the basic needs or to communicate or for advocacy. Like that, we will go ahead with the communication skills. So our focus will be there. But when you want to enhance the life skills, we need to focus on styles of communication. Mainly the styles of communication, one is passive, aggressive, and confident. So when you give this option to the children, then whatever the behavior problems you are seeing, that can be reduced because now they got a choice to present in different manner. Like passive means he will keep quiet, so you don't need to disturb the child. Second one, he want to say something very strongly, so he can use aggressive communication. When he feel confident, he will use the confident communication skills. So that now the child has the power in his hands. So generally, most of the behavior problems occurs due to the problems or deficits in communication skills. So that can be encountered with this. So when the child will learn different styles of communication, so he will use different methods. So instead of showing the tantrums, he will try to use himself. So he will use different styles of communication to express his views. Yes, ma'am. Revati miss?
Yes, ma'am.
Hello,
Thank you,
Revati
ma'am.
miss?
Yes,
Yes, ma'am.
ma'am. Thank
So this is the
you, ma'am, for
yes,
wonderful
ma'am.
presentation, ma'am.
Thank you.
Included all the parts, all the areas of life skills. Thank you so much, ma'am. So we have participants.
Thank you.
Questions asked by the participants, and for the first question, I request Vijayalakshmi madam. Ma'am, are you here, ma'am? Hello, Vijayalakshmi ma'am.
Yeah, tell me.
Yes, ma'am. So there is a question in the chat box, ma'am. Balaji is posted. Sweta's child is cleft and cleft palate child. She is struggling when she is sleeping, little breath problem. So for 1 hour like that. So after that it is normal.
Okay, is it operated, Revati?
Ma'am, that we need to ask Balaji sir. Can you please unmute yourself and interact with madam?
Yeah.
Yeah, we have other question also, ma'am. Meanwhile, you can answer that question. One child with ASD children, child is having a sleep problem at night for no, the whole night the child is not sleeping, ma'am.
Okay. Yeah, they can. I'll answer that first. ASD. Actually, they should. Are they our clients? Because we want to know whether they have undergone any test. Must be having some allergy, or is he snoring, or is he having difficulty? This acid reflex. Are they using melatonin for sleep induction? Are they using any tablets? All that.
Yes, ma'am. He has given answer that did 3 operations.
For what?
Not taking tablets. That the child is undergone for 3 operations.
For
Sir,
not swallowing.
what surgery, sir? Can you unmute, or I can write it in chat box?
Actually, they can. Actually, they can come to NIPMED. Are they clients of NIPMED?
NIPMED. Ma'am, yes, madam. Sweta child, she is coming to NIPMED.
Okay. What surgery she has undergone? What surgery they have undergone?
No, he have no surgery or not have any allergetic issues.
Okay. What the child eats well? He eats well.
Hello.
Can he? He's eating well.
Yes.
Okay. What exactly is your problem? Hindi. You are Hindi speaking, huh?
Yes. हिंदी
बोलिए ना, क्या तकलीफ है आपको?
उसका प्रॉब्लम ये है कि जब से ये लॉकडाउन पीरियड शुरू हुआ है तब से वो एवरी वीक में एक रात सारी रात जागता है। जब सुबह होता है तो वो सोने जाता है।
अच्छा। उसको तो कुछ डीवर्मिंग किया है आपने? वो डीवर्मिंग है ना, वो वर्म्स के लिए जो भी देते हैं वो किया है। अच्छा, ये तो बोर्डम हो गया है। फिजिकल एक्टिविटी थोड़ा घर में करता है क्या? गौरी
हाँ हाँ
मैडम ने बोला था
हाँ हाँ करता है,
वो तो कर आप तो
करता है, पर अभी तो स्कूल थेरापी सब कुछ बंद है।
हाँ, इसलिए तो
फिजिकल
एक बार तो
एक्टिविटी
ऐसा हो
थोड़ा
जाता
बहुत घर पे कर लेता है, और सुबह से उसका स्कूल का क्लासेस चलता है ऑनलाइन, तो
हाँ
इसके चलते उसका स्क्रीनिंग टाइम भी
बहुत
बहुत ज्यादा।
ज्यादा हो गया। स्क्रीन टाइम आप तो कट करना है। उसके बाद आपका कितने घंटे तक वो स्क्रीन में रहता है?
हेलो,
कितना घंटा वो स्क्रीन के सामने रहता है?
उसका स्कूल का क्लास चलता है 4 आवर्स।
4 आवर्स, वो बहुत ज्यादा है। फिर वो भी खेलता है ना स्क्रीन में?
हाँ, खेलता नहीं है वो, टीवी पर्टिकुलर वन टीवी सीरियल वो देखता है।
अच्छा, इसलिए तो बहुत ज्यादा हो गया। इसलिए थोड़ा वो आप तो कट नहीं कर सकते, लेकिन आप थोड़ा मिल्क दे दो उसको, हॉट मिल्क दे के देखो।
सोने से पहले?
हाँ, पहले थोड़ा इंड्यूस हो जाए।
ओके
और
ओके।
लाइट को बंद करो, वो सब करते हैं आप ना। लाइट बंद करो, और सॉफ्ट बेड, आपका कुछ साड़ी नहीं तो सलवार का कुछ है तो उसके ऊपर से। कितना साल का है वो? हेलो।
Yes, ma'am. We
हाँ
have one more question, ma'am. So, how
हाँ,
to change sleep routine to the child to 6 years age, ma'am?
हाउ टू
Change sleeping routine to the child.
Okay. Okay, you have to, yeah, give the physical activity in the evening, 4 to 5. Let them play something inside the house. And then, if it is possible, if there is any place outside the house also, they can play. Then 1 hour play, some physical activity. By 7 o'clock, give a warm water, no? Lukewarm water bathing. And by 7:30, give some food, whatever he likes, but not that which causes allergy to him. And then you can you can lie down near him, or his father can lie down near him and tell stories, or they can sing a song together. And they can actually, he should be taught, all the lights should be off by 9:30. And compulsory he should go to bed. That time should be taught to him, 9:30 or 10. And wake up also, some vibratory alarms can be kept at 5:30, like that. 6 o'clock, they may not sleep well, so alarm can be kept. And they should
Thank you
see
so
what,
much, ma'am.
yeah.
Yes. Thank you, ma'am. Thank you so much, ma'am. So, Anushya, ma'am, are you here, ma'am? Anushya, ma'am. One more question and two questions that
Yeah, I'm
posted on
available.
related to behavior problem at children classroom, that is there in the chat box. So madam have answered to the question and it is in the chat box. So Anushya ma'am, there is one question to you: how to introduce visual schedule to the children with ASD?
Okay, so when you have to introduce a visual schedule, initially what you have to do is you have to find out whether the child is able to match a object with an object, or match an object with a card, or a card to card. So first the matching abilities needs to be assessed, and based on that, maybe your visual schedule, initially what you have to do is help the child to match the activity flashcard with another flashcard that you have kept near the task wherever he has to perform. Say for example, give the flashcard when he enters the classroom. He needs to carry it to the place where he has to perform the task, and then keep the flashcard there, finish the task, and then take back that flashcard and put it in the finish box. Then you have to give another task, and then he can go perform and then bring back and put it in the finish box. So this kind of helping will go along with the strategies of prompting. Initially we may have to model the child and do physical prompting along with verbal instructions. This needs to go parallelly for him to understand a visual
ma'am,
schedule is being performed. Then what we have to do is initially to start with, go for first, then okay, the two-step alone you do it. Then maybe you have to increase the number of schedules for the child. So for him to learn, initially have object stage with one step where you give that, he go to the play zone or he go to the workstation, he perform that and come back and put it in the finish box. Then gradually add on activities to that so that he will be able to transit from one activity to another activity with a physical prompt. Later he should be able to do it with a timer set along with that, maybe maximum for 3 minutes, and then he can go for a next phase of doing the task. Yeah, Revati?
Okay, ma'am. Thank you, ma'am. We have one more question for Vijay, madam. Ma'am,
Now tell me.
is there any test to find out the food allergy in ASD kids, ma'am?
Yes, there is a test. Blood test is there and also skin test is there. You can go to Apollo or Apollo Hospital. They are doing it. But they may not do it in Corona time. I don't know. Maybe you can phone up and ask for allergy for food particles and food, any food. This is done in Apollo Hospital.
Thank you, ma'am. Thank you, ma'am. Thank you, ma'am. I think they have taken.
Yeah.
It is not written that not allergy, any test if it is there like that.
Yeah,
They have
actually food,
answered, ma'am.
any kind of reaction to food can be found out by doing an allergy test for gluten, the brinjal, curd, everything they have. For everything they have. Dals,
Yes,
detergents,
ma'am.
on subcutaneous skin test for detergents, soap powders, all that are there. Dust, house dust.
So one more question we have from Balaji, that's about Sweta. She's doing all the activities, but writing, she is expecting her to, no mother to hold the hand, then only she is writing. So, madam, this is initially the child when start with a physical prompt, and it should slowly faded, and then the child tries to write on the phone. We can do a lot of activities with board, tracing board. You can the child to trace the letters on the sand or in the notebook also. So I do activities with concrete, and then you can make the child with support. You can slightly no reduce your support and make the child to write. Yes, thank you, ma'am. Thank you all just for the day. I think it looks like we have answered all questions. So if anything else you'd like to mention, if anybody wants to mention, you can go ahead, ma'am. Is there? Okay. Okay, ma'am. And now we need to make some announcement, like feedback link is given in the chat box in YouTube also, in Google Meet also. Since Certify-M allows only 100 participants per day, so the link will be open for 2-3 days. You can submit it later on and get the certificate also tomorrow or day after tomorrow, so that can be done. So thank you everyone. So little formal note of thanks. So I propose I am here to propose the vote of thanks. So I thank our honorable director NIPMED Sri Nachiketa Raut, and our HODs Sri P. Kamraj sir, our no valuable most valuable guest Professor Jayachandran sir, and participants and my dear colleagues and my students studying in B.Ed and M.Ed in the department. So it's my privilege to who have been asked to propose a vote of thanks on this occasion. So I, on behalf of NIPMED and my own behalf, extend a very hearty thanks to our director and HOD for the guidance that they have extended to us, and a deep sense of appreciation to all speakers, Dr. J. Vijayalakshmi Madam, Mrs. I.J. Anushya, Mrs. Sri Gauri Rajesh, Mrs. Leelavati Madam, for sharing with us with their expertise and knowledge today. So I may also like to express my thanks on again to the department colleagues. So they were supporting me with the technical part. Thank you all the participants for being with us for this webinar. So yes, we will hope to see you in next time. We have a few upcoming webinars on 18th and 24th on other topics. So uh, we will meet you in next time. So thank you all. Thank you again, madam, once again for participating, sparing your time with us. Thank you, ma'am.
Thank you, Revati, for giving us opportunity.
Thank you all.
Thank you.
Thank
Thank you all.
யாரோ ஒருத்தர் ஒரு இது கேட்டா கொஸ்டின் கேட்ட ஆன்சர் பண்ண முடியல.
Ma'am, please leave. Everyone, participants, please leave the meeting. Shekhar, Pratap, Meenakshi. Yeah, please leave the meeting. See, if feedback link is allows only 100 participants per day. So you can copy the link, and the same link you can use it tomorrow to get you can submit it the feedback tomorrow. Yeah. So definitely we will send you the certificates to all the participants who have submitted the feedback, and you can submit the feedback and get the certificate tomorrow if you are already joined in the Telegram and WhatsApp group. So participants, please bear with this issue. We will solve this in 2-3 days. Okay. Shall I tell them they can send to our email ID? Yeah, you can tell. Sorry.
Hello, मेरा क्या? Hello, hello. Hello.
எந்த லாங்குவேஜ்மா அது? மா அக்கன் எந்த லாங்குவேஜ்மா? தெலுங்கா, தமிழா, மலையாளமா, கன்னடமா? கன்னடம் தானே?